Good morning. I'm going to go ahead and call to order the Committee on Affordability, Accountability, and Planning, our March 26th meeting. I'd like to welcome everyone here today and appreciate your attendance. Please be advised that this meeting is being broadcast over the internet, so you're on if we find you out there. Before we get started, I'd like to introduce one of our new coordinating board members. Jacob Monty has joined the coordinating board. He was appointed here by the governor in January, and Mr. Monty is the managing partner of Monty and Ramirez, which is the largest Hispanic-owned employment and immigration law firm in the Southwest. He specializes in employment, labor, and immigration issues and represents employers and investigations and audits conducting by the National Labor Relations Board, Department of Labor, Immigration and Customs Enforcement, U.S. Citizenship and Immigration Services, Occupational Safety and Health Administration, and Equal Employment Opportunity Commission. So, Jacob, we are very pleased to have you join the board. We welcome you and we look forward to working with you. And if you'd like to say hello to the group, we'd appreciate that.
Thank you, Vice Chairman. Thank you. It's a great honor for me to serve. I thank our governor and the state of Texas for giving me this great opportunity. Thank you.
Thank you, Jacob. We look forward, like we said, to working with you, and we'll see you on this committee, and then we'll see you back when we have the full board together. So look forward to being with you. Agenda item number 2 is consideration of approval of the minutes from the December 11th, 2013 meeting. Are there any questions or discussion from the minutes?
Move approval.
I have a motion to move approval. Is there a second?
Second.
Chris, thank you. All in favor of the motion, please say aye.
Aye.
All opposed? The motion passes. Thank you very much. Agenda item number 3 is the consideration of the approval of the consent calendar, which was put out. Do you have any questions or discussion about the items that are on the consent calendar?
Move approval.
We have a motion for approval and a second.
Second.
All in favor say aye.
Aye.
Opposed? Thank you very much. Agenda item number 4 is public testimony on items relating to the Committee on Affordability, Accountability, and Planning. To my knowledge, we don't have anyone signed up to give testimony, so we will move on to agenda item number 5A. And this is the update on the Rand Community College's baccalaureate study addressing the state's projected workforce needs for training and education. Senate Bill 414 and House Bill 1296 in the 83rd Texas Legislature regular session. We have Charles Goldman with the Rand Corporation who's going to provide a presentation on the progress to date for both of these studies. This is intended to have a discussion with the board about possible policies, and that's what I'd like to emphasize to the committee members. We're going to have a very thorough presentation, and the idea here is that it is a discussion, and we really encourage everyone to listen closely, but to ask questions. This is the time where we really need to have a dialogue on these studies and this topic. So I will turn the program over to Mr. Goldman.
Thank you very much. It's my pleasure to be here again with you. I saw most of you in January at the board meeting where I gave you a very short introduction and we had some preliminary discussion. And I want to encourage you to jump in with questions or comments during the presentation if it suits you, or of course we can have more extensive discussions at the end. You've been given a copy of the slide presentation in your agenda book. We are conducting 2 studies for you, both required by the legislature. The first on the community college baccalaureate question, and the second on using data to model future workforce needs to help improve planning for degree programs. And today I'm going to concentrate on the community college baccalaureate study. The objectives of the study are to... Can I get this on so I can... Easier for me to see if we could turn that one on. Thanks. The objectives of the study are to help the coordinating board to develop a process to analyze statewide and regional workforce needs for bachelor's degrees in nursing and applied science fields, to determine the appropriate providers in those fields, and if community colleges are seen as appropriate providers, to inform decision-making over which community colleges should be authorized. I'm going to give you a quick overview of the methods. Before I do that, let me just mention by way of background that there is an emerging national trend to authorize community colleges to offer baccalaureate degrees. And as of the most recent data that we have, 17 states allow community colleges to offer baccalaureate degrees. Texas is one of them. 10 years ago, Texas authorized 3 community colleges to begin offering baccalaureate degrees. Florida and Washington are the 2 states that have moved farthest, and they have both have substantial numbers of colleges. The other states typically only have a handful of colleges. The methods that we use for this study are quantitative analysis, interviews with employers, professional leaders, accreditation agency, and post-secondary institutions, and a review of literature and existing policies in Texas and in other states. And we're doing that in order to help you develop a process. In order to understand regional variation across this state, we selected 4 regions for in-depth fieldwork. So our team visited the Gulf Coast Houston region, Dallas-Fort Worth, the West Central region, and the lower Rio Grande Valley and Cameron County. We recognize, of course, that there are many more important areas of the state, but within the resources of the study, we had time to visit these 4, and we think that they gave us a good perspective on both urban areas and less urban and more rural areas. In the course of the study, we spoke to over 300 stakeholders. And you can see here on the slide, we spoke to 2-year institutions in these 4 regions. We spoke to public universities. We spoke to a few private universities. We spoke to quite a number of employers. We also talked to other experts related to these professional fields, for instance, from the Texas Board of Nursing. We talked to a representative from the SACS Accreditation Agency, and we also talked to a number of stakeholders in Florida and Washington to get their perspectives, from state policymakers to university representatives and community college representatives in those 2 states. We also conducted an early webinar in November to introduce the study to the stakeholders. We circulated a brief survey following that, and we received 10 written replies to that survey, and we incorporated those into our analysis as well. Yesterday, we held a second webinar using a presentation very similar to the one that I'm giving you today, again, so that the stakeholders could see the draft findings and have a chance to understand them.
And I'd like to say that we did have some technical glitches at the webinar yesterday, but for everybody who is listening now, it will be posted on our website by Friday, and we are still accepting comments, but somebody did end up getting bumped off and didn't get back in. We want to make sure that they are more than welcome to comment on it and listen to the webinar as presented yesterday, or to continue listening to this presentation.
Thank you, Susan. You might remember from my short presentation in January that we think about the decision about offering these possible baccalaureates in 4 stages. So first question is, does the field require a bachelor's degree? Second is there a sufficient supply of people with those bachelor's degrees? Third, what's the best approach to offering those bachelor's degrees? And if community colleges are seen as a promising approach, which specific community colleges ought to be authorized? So in terms of needing a baccalaureate, we can compare and contrast between certificates, associates, and bachelor's programs. We look at the supply and demand. We consider the best approach. Is it better to use the capacity that state universities have in this field and either expand existing programs or start new ones? Is it best to create partnerships between state universities and community colleges, or is it best to develop the baccalaureate programs at the community colleges? And then finally, we would look at which community colleges, if community colleges are selected. And so in today's briefing, I'm going to show you evidence that we've analyzed that bears on these 4 stages. So I'll be showing you evidence on supply and demand in 5 specific fields that will help us understand the first 2 stages. And then I'll be showing you a variety of evidence on the benefits of expanding baccalaureates at community colleges, the concerns that this would raise, some information about costs, some guiding principles, and some findings about the THECB process. Let me turn now to reviewing the evidence on unmet workforce needs. The legislation that authorized this study specified 2 areas of study: nursing and applied science. Now, applied science is a very broad field, so we selected 4 specific fields within applied sciences to study in depth in this study and to serve as a model that the coordinating board can use going forward. And those fields are computer and information technology, technical supervisors, fire sciences, and health information technology. And I'm going to talk about each nursing and these 4 applied science fields, each one in turn. We assess unmet workforce needs by looking at 3 factors. So the first question is a baccalaureate needed? And to do that, we look at whether the knowledge, skills, and abilities that these occupations demand require more than 60 semester credit hours to develop. So this is something that's more than a 2-year degree can develop. We also look at what employers put in their job postings. What's the entry-level qualification that they demand? If there is a licensing, professional, or regulatory body, do they have a standard? And so we look at that. And all that helps us understand whether a bachelor's degree is needed. Once we understand that, we look at the level of demand. And what we've done in this study is we've taken the projected annual job openings that the Texas Workforce Commission produces, and they produce this a decade at a time, and we look at what is the estimated percentage of those job openings that would require a bachelor's degree to try to give us a sense of what the level of demand is. We then look at the current sources of supply. So what are the existing community college and university programs that might meet these demands? In some cases, we may also consider private providers or out-of-state providers as contributing to the supply. One of the things I want to note is that in Texas, the state has public universities with significant experience offering applied baccalaureate degrees. And this is in contrast to many other states. For instance, in Washington, which we studied, their universities have very little experience with applied baccalaureates. And so it was, in a sense, smoother for them to agree to give that mission to community colleges because they didn't have universities doing it. Here in Texas, you do have universities doing this mission. There are 2 main types of applied baccalaureates. The ones that we're going to call field-specific first. And a field-specific baccalaureate follows a very defined course of study. These are offered by some universities, and they are offered by the 3 community colleges that are currently authorized in the state to offer them. They're called Bachelor of Applied Science, BAS, Bachelor of Applied Technology, BAT, or Bachelor of Applied Arts and Sciences.
So can you define for us the community colleges and what exactly those 3, just so to refresh us?
Certainly. So the 3 community colleges that were authorized by legislation are Brazosport, Midland, and South Texas. And all 3 of them offer the Bachelor of Applied Technology degree. Brazosport and Midland have 1 degree program, and South Texas, 3? 3 degree programs in South Texas. And I will mention this later, but the current regulation or legislation allows them to propose up to 5 programs each.
And another quick question, just so I have my understanding of that. There's 3 of them. How long have they had these programs?
The legislation was passed in 2003, I think, and the program started in the mid-2000s.
And so when that happened, did it specifically target these 3 community colleges? Were they the only ones who applied? How did it become that these were the 3? What was the method to that thought process?
These were the 3 institutions that were approved and recommended by the coordinating board, and for the degree that for a Bachelor of Applied Technology.
They were specifically named in the legislation.
That's what I'm trying to understand.
They were the only 3 that were permitted through law.
And do you know what the rationale behind these 3, or these specific 3, or the number of 3? Okay. I know.
All right, none of us
I mean,
were on the
I
board
think,
when that
you know,
happened, so I guess all the details are a little...
Answer was in the district of one of the schools.
Right.
And then I'm not sure the process of including the others. The one where the industry was clearly specific was Brazosport, with process control technology and the chemical industry.
Thank you.
Thank you. So Brazosport's a good example of one of these field-specific degrees. It's closely linked to the local industry, and industry often sponsors their students to attend the bachelor's program. In contrast, there are multidisciplinary BAAS, or Bachelor of Applied Arts and Sciences degrees. Those are only at universities. And these are, I don't know if you're at all familiar with them. This was actually a little bit new to me in the course of the study. These are degree programs that allow students that started with an Associate of Applied Science, a 2-year technical degree, to earn a bachelor's degree, but they typically don't impose any curriculum structure. So all the student has to do to get this degree is to meet all the requirements for a bachelor's degree. So you have to have sufficient credits in general education, have to have sufficient upper division credits, but it's up to the student to choose from courses in the university catalog that student is interested in to put this degree together. And this is offered by a number of universities in the state. It's going to be important because we're going to come back to this, these field-specific versus general ways of meeting workforce needs. So I'd like to talk through now nursing in the 4 applied science fields. And I want to mention that in the appendix to the briefing, you will find slides with more detailed information about the unmet workforce needs in each of these 5 fields. I'm going to cover just some of the high points right now. We can certainly discuss these further if you'd like. Nursing is a field with very strong demand. I think that's quite well known. But it turns out the supply of bachelor's programs, or the supply of bachelor's graduates in nursing, is also expanding very rapidly in this state. I'm going to show you a few figures. So the Institute of Medicine has set a goal that by 2020, all registered nurses, 80% of registered nurses should hold Bachelor of Science in nursing degrees. So we looked at what the current population of registered nurses in Texas looks like using the Board of Nursing data. And you can see on the map, the dark green regions, and these are by the workforce development areas that the TWC uses. Dark green regions are the ones with the highest percentage of Bachelor of Science nursing. The urban areas, DFW, Houston, so forth, tend to have about 55 to 60%. So even the areas of the state with the most concentration are still quite a bit below the 80% target. There's also pressure because hospitals in Houston and DFW would like to receive magnet status And in order to receive that status, they need to have either 80% of their RNs with BSNs or have what is judged to be a credible plan for getting their RN workforce to the 80% level. So there's a lot of pressure, particularly in Houston and Dallas-Fort Worth. If you look at the rest of the state, you can see the less urban areas typically have quite a bit lower percentage of BSNs. In fact, if you average across the whole state outside of the 4 largest metro areas, the rest of the state has only about 35% of the RNs holding a BSN degree. And what employers told us in the regions we visited was that while they would love to have more Bachelor of Science nursing in their RN workforce, they also know that earning those BSNs typically motivates people to move to Dallas, Fort Worth, and Houston, where there's a lot of demand. And so it's not clear that the rural areas are really going to be approaching that 80% anytime soon.
Mr. Goldman? Mr. Chairman, quick question. I'm not used to seeing El Paso, the El Paso region highlighted among the leading areas. And I'm from El Paso, Chairman, but why is El Paso doing better than other areas? People never leave.
And they have,
There's a couple of nursing schools there.
yeah.
So,
Well, and I might comment too. I think that they've recruited heavily advanced practice nurses because there's kind of a shortage of physicians. So if you look at some of the programs along, I've recently been to Big Bend, and there are not many doctors in that whole 500-mile area. So most
of course, there's not very many people.
Well, I
either.
know, but most of the health care there is done by advanced practice nurses. So. And that is probably based on, not having many healthcare providers at all, but of the ones they have, they've recruited very well.
So the question I would have is how did the IOM come up with this 80% number? And this is all being built upon someone else's idea that this is better. Is there proof that we really need to have the preponderance of our nurses trained at the BSN level? And are there studies that show that they get higher quality outcomes and the costs are more efficient and the value is there for the patients? Or are we simply chasing somebody else's idea of what might be good or better?
The hospitals are saying they want to reach the 80% so that they can reach magnet status.
I understand that, which doesn't explain at all the answer to the question, why do they need a magnet status? I've been through this with several hospitals, and I have yet to get a straight answer.
Follow the dollars?
Yeah. So it's all about the money and getting a magnet status so you can get more money, but nobody showed higher quality outcomes, lower costs.
Well, I guess the IOM report did a review of the evidence. It showed that BSNs have higher quality patient outcomes, better safety, fewer accidents than associate degree nurses. And what has happened as a result has been a huge growth in RN to BSN upgrade programs. Okay. What I think is very questionable about this is at the time the research was done that fed into the IOM report, these RN to BSN programs were not prevalent. So what you had was a comparison of two different nursing populations. A population of students who were motivated and qualified to enter a 4-year university program and graduate with a BSN, get licensed as an RN, and go into practice. We had a different population that, for whatever reasons, didn't follow that path. They went typically to community colleges. They got an associate degree, which is also eligible for licensure as an RN. They got licensed and they went into practice. And so the research compared outcomes from these two populations of nurses. And I think it is a highly questionable assumption that taking the second population of nurses who has associate degrees and sending them through these RN to BSN upgrade programs will necessarily make the outcomes that they would have in patient care the same as the outcomes that this research looked like. But that seems to be the assumption in the field. The other, I think, other important driver of this, which I don't think targets a specific percentage, is that because of the cost of healthcare and because of the relative scarcity of physicians in many places, there is a strong pressure to give nurses greater responsibility for primary care. That is going to require advanced degrees in many cases. There are a lot of states require at least a Master of Science in Nursing to be an independent nurse practitioner. There's a movement even to require the relatively new Doctorate of Nursing practice in some places. And so in order to have a feedstock that can feed those graduate programs, then the nurses have to at least earn their bachelor's degree to even be eligible to go on. So I think there are a combination of some very genuine pressures in the healthcare system that do demand higher levels of education, but there's also this signpost that has been planted by the IOM saying 80%.
A related question, I've wondered if in the study, and I don't know if you know this, if in terms of the quality of care, if there's part of that could be attributed to rural hospitals perhaps having a larger percentage of nurses with this level of education, and rural hospitals in general having fewer resources to bring to bear on the health of the patient in terms of whatever equipment might be available versus in an urban hospital, and if that was not accounted for in the study, if that could attribute to some of the difference. I don't know how it was conducted.
The IOM was based on best practice research. The whole paper was based on best practice research. You're correct about the population that they were looking at, and of course that report is now how many years old? At least 3, maybe 4. It came out in 2010, I believe. But even though this isn't really the platform for this discussion, Dr. Tesher, but I will say that having hired many, many nurses in my career, I would always prefer a BSN based on the ability of skilled decision making, the ability to be independent and to be action-oriented, the ability to really use research as a background for making decisions versus just being task-oriented. So the goal for magnet hospitals is really to reduce turnover. That's the biggest cost to hospitals is turnover. And if you have a magnet hospital, you are saying that nurses are more likely to enjoy working here. They have a gratification of their profession, so they're going to stay. The longevity of nurses in any kind of healthcare situation, as Mr. Huckabee knows, gives you so much more value in an institution than the constant turnover. Or, as you were saying, when nurses can get their BSN, you know what? They can go to Dallas, Houston, or any of these metroplex and get a lot more money for their efforts. I mean, there's such a salary difference. So that's why you're probably seeing a drain of good nurses leaving the rural areas because they know they'll get paid better. Magnet hospitals actually pay better. So the whole emphasis on BSN is remember that the RN is giving the frontline care to everybody, all patients, and patients don't want the least educated workforce. They would prefer to have a higher educated workforce. So that is really it's a patient satisfaction. Of course, you know we get paid for that now, and that's part of what the payers want. That patient satisfaction means millions of dollars to hospitals. And hospitals with a higher level of saturation of BSNs actually have higher patient satisfaction. So it all is complex. And so, but I think the discussion really needs to be more about what our study was about. Does that help? Thank you. Sorry.
So, all right, let's look at the sources of supply. So the TWC is projecting roughly 10,000 new registered nurse openings per year. That's really quite a lot. There are right now 50% of the RNs in this state hold a BSN. So if we simply wanted to maintain the current 50% level, we need 5,000 of those openings to be filled by new BSNs every year. And if we want to reach toward this 80% target, then we obviously need a greater number. And what we can see is, if you look, there's been a significant ramp up in the production of BSN graduates over the past 6 to 7 years. The number of graduates in total is close to 8,000 a year now, and a little less than half of that is coming from these RN to BSN programs. If we look at enrollment figures, so this is graduations, if we look at enrollment figures, we see an even sharper increase. And so the blue line is the number of enrollments in these RN to BSN programs. And you can see after the 2010 IOM report, it really takes off. Turns out that UT Arlington's online RN to BSN program accounts for 75% of all of those enrollments in the blue line. And a third of all BSN enrollments in the state. So it's clear that there is a big demand for new nurses with BSNs, and there's a big demand for existing RNs who have associate degrees to earn BSNs. Regardless of what we think about the motivations behind them, it's clear that in the marketplace there is a big demand for both these groups, but there is also rapidly growing supply. So it's not so clear from a policy point of view what the right thing to do is. And what we heard in our interviews is that the university programs have capacity that they could expand, but they're limited because they cannot attract qualified nursing faculty. And particularly for pre-licensure programs, they have to meet very strict student-faculty ratios set by the Board of Nursing. And so in order to expand pre-licensure programs, they need a lot more nursing faculty. So one of the comments was made was, if we could find or grow more nursing faculty, we could expand, and we wouldn't necessarily have to open new degree programs. We could expand the ones we have.
Question. So the UTA program, because it's online, do they face the same faculty ratio problems?
Post-licensure, unless the program seeks national accreditation from the nursing professional body, there are no restrictions on faculty. And as I recall, it's a very high ratio. I think the faculty-student ratio in UT Arlington's RN to BSN program is something like 350 to 1. So they're able to have a relatively small number of faculty serving a very large number of students because they don't have any of those regulations to meet. And that was one of the arguments that was made in favor of opening programs at community colleges, is that the community colleges wouldn't follow that model and that they would offer a face-to-face education, and that they would provide something that was more rooted in hands-on practice than what UT Arlington is doing.
So that brings up two questions then. If the existing programs can't find faculty, how are the new programs at the community college going to find the same faculty that don't exist for expansion of the existing programs?
Yeah, I think that's a very important question. And indeed, if new programs are opened, it could worsen the competition for the faculty, because what often happens when you open a new program in any field is you really want experienced faculty to start up your new programs. You go and find them somewhere else. You hire them away, and then that leaves the existing programs facing a shortage that they have to fill.
And then the second part of that question, I'm sorry, just a second, is with the UT Arlington program and the very high student-to-faculty ratio, are we still turning out a quality product that's equal to the lower standard nationally certified ratio, or are we creating something that's still maybe a standard below that? Has that been looked at?
I am not aware of any research that looks specifically into that, but I think it is a question that needs further investigation.
Well, let me be transparent here. I did the UTA RN to BSN in a seat years ago, not online, but knowing now what online programming is about, it easily could have been online. The same exact program that I took years ago sitting in a chair in the building has now been converted to the UTA program. There is virtually no difference. I will say that I'm totally in agreement with you that the ability to measure doesn't really, this part of nursing doesn't have to be face-to-face. But the way the UT program is set up, there is enough with every student where they are that they can plug in. They have to be mentored by, another nurse that's experienced and normally a master level, but their actual faculty, it can be done. I'm just looking at the WGU example of how they do online. I think we should move more, even on the BSN level, to doing competency level education. It would allow UTA to actually move more nurses through the program at even a cheaper cost. But I will say, because I did this program in a chair, and now they're doing it online, there is virtually no difference. And you don't you don't take care of patients during this part of the nursing education. This is about leadership. This is about decision making. This is about deciphering, triaging and things like that. This is really about raising the level of competency for nurses, but it's not teaching you how to do an IV and a dressing change and things like that, because you've already done that. You've already been licensed to be safe at the bedside. So does that,
So you're saying the online is the non-technical skills portion of the education?
Right. The task-oriented skills are now already in place. So what you're giving this nurse is professionalism.
So I guess my question is if we already have this and it's a successful model and it's meeting magnet status, it's getting nurses paid more, and then they can move to the Metroplex and get a real job with real pay, why don't we expand that model, and why are we continuing to try to chase something that, ever since I've been on the coordinating board,
right,
we've had a shortage of nursing educators.
Absolutely.
And I don't hear anybody coming up with a solution to that.
I'm in total 100% agreement with you.
Well, very good. If it's all right with you, I'll move on to the other fields that we studied. Computer and information technology is a very important field in this state. We, just in terms of definition, we tried to distinguish the more applied computer and information technology occupations from the more theoretically based occupations that university computer science graduates would typically go into. So we're looking at occupations that are in applied, hands-on, often supporting roles, in network administration, computer security, and so forth. There's a great deal of evidence that there are occupations in these fields that require knowledge, skills, and ability beyond what a 60-semester-hour program can build. That there is a demand for something beyond the associate's degree. Employers told us that they're increasingly specifying bachelor's degrees, even for these more hands-on positions, as either required or preferred. And based on the estimates that we could do from the Census American Community Survey, we estimate that about 60% of the job holders in these fields currently have a bachelor's degree in Texas. So it's a field with a fair prevalence of bachelor's degrees. This is a very large, rapidly growing set of occupations. TWC is projecting almost 19,000 new job openings per year in these fields. So very large. So to keep even the 60% bachelor's ratio that currently exists, the state would need 11,000 bachelor's graduates a year, or potentially bring them in from out of state, which is clearly happening. This is a field where the openings are highly concentrated in the 4 largest metro areas: DFW, Houston, Austin, and San Antonio. That's where the openings are. There are some applied programs in universities in these applied IT fields. There are actually 23 different degree programs offered in the state, but they're relatively small, and last year they graduated fewer than 600 graduates. So there's a huge distance between the production in these applied baccalaureate fields and the kind of demand that the state has. So what are employers doing? Well, they're recruiting from out of state, but they're also making do with something other than bachelor's degrees. And some employers told us bachelor's degree is not essential. Need to have a set of skills, but they could acquire that by starting with an associate's degree and then earning specific credentials or certificates in various networking or security technologies, which are often offered through community colleges. What we heard was that one of the biggest obstacles to growing graduates is not necessarily the existence of programs. It's having a pipeline of students who are qualified and interested in these fields. And so this is, I think, a little bit of a tricky one. It does look like there's definitely room for more programs. There's a huge gulf between what the state needs and what it's currently producing. But the strategy probably needs to address preparation and interest of the students and not just say, well, let's have 10 more programs. Technical supervisors is a category that we put together from a number of similar occupations. And all of these occupations have the same fundamental structure in that they're production industries in which employers have a need for first-line supervisors of production workers. So you find them in oil and gas, chemicals, you find them in other kinds of process industries. And what employers said is, to promote employees up to these supervisory positions, they need them to have management and leadership skills that they wouldn't have from their technical associate's degree. The employers we spoke to prefer industry-specific degree programs. And employers are currently supporting some of these, so the Brazosport program is well supported by local industry. Although employers told us that they would like these supervisors to hold bachelor's degrees, the fact is only 1/8 of supervisors in Texas in these occupations currently hold a bachelor's degree. There are about 1,000 openings a year in these occupations, according to TWC. And if we follow the rule of trying to at least maintain the level of bachelors, we would need about 125 new grads a year with bachelors. But it seems that there's a clear pressure from employers to increase the credentials that their supervisors hold, and so that the true demand is likely greater. This is the most geographically concentrated of all the fields we studied. About half of the statewide openings are in the Gulf Coast region. Employers are looking often to engineers to fill these positions because they have bachelor's degrees, but a bachelor's in engineering doesn't really confer the kind of skills that these positions need. There are 6 existing applied programs. They graduated about 150 graduates last year. There are also many of these multidisciplinary BAAS programs that I mentioned at the universities that students could use to learn these additional skills. So there are a variety of ways of solving this need, but employers would clearly like to have more industry-specific degree programs, and so there may be reason to do that if there's a close match between an educational provider and an employer or group of employers.
So the 6 programs that currently exist, are they at community colleges or are they at 4-year institutions, and are they geographically located near where the demand for those jobs are?
They're a combination of community college programs and university programs, and they are typically located in proximity to a specific employer or group of employers.
And from the employer's perspective, is there a preference or difference in the graduate from the community college program versus the university or 4-year program? Or is that something that didn't come up in the discussions?
I don't. You remember, Lindsay? If
Can you say that one more time?
From the employer perspective, the prospective employer, is there a preference that they receive a graduate from the community college versus a 4-year institution, or is there no preference, or is that something that didn't get discussed?
So it wasn't necessarily discussed, but I will say that the support that, especially when we were in the Brazosport area, from the employers to really push these the employees that they had through these baccalaureate level programs really showed the that they really needed the degree and the certain skills. So
the employers were accepting of that coming from a 2-year institution,
yes,
granting a 4-year degree in
yes,
the BAAS. Mm-hmm. And so are there technical expertise in the industry co-located in that area that also serve as part-time faculty? Is that expertise
yes,
available? Is that
yes,
what makes it unique?
Yes, and in our interviews, basically what they were saying was a lot of their faculty members were retired, and they were the ones that were coming back who had been in the workforce, and so they were giving them, sort of imparting these skills on the students that were going through these different programs. So yeah, and that's what was interesting too in the interviews is that you know, kind of what they were saying was that they're really preparing them for specialized skills that the employers are telling them that they need, which is why they look so favorably on these BAAS, BAT type programs when we were in the Brazosport area. It seemed to be a very successful partnership.
So at least in the case of these technical supervisors, it would seem that geography and location near the employability would be a critical factor.
Yes.
Critical.
Yeah.
Absolutely critical. I will say that I do recall we did specifically ask the computer and information technology employers whether they had a preference for community college baccalaureates versus university baccalaureates. And as I recall, they had no preference, and they were very clear about that, and they said they thought that either approach could produce a good graduate. One of the employers in computer technology, I thought, gave a very useful way of thinking about this. And what he said was, this was in cybersecurity. He said, it is a field that you need both conceptual theoretical understanding of how computers work, so you can understand where vulnerabilities are, but you also need a very practical, hands-on problem-solving approach, because it's not about, at the end, it's not about theory. It's about fixing something or making a system more secure. And he said, I can take graduates that start out either as hands-on and applied, and then help them get the theoretical understanding on top of that, or I can take a graduate from a university program that has lots of theory but very little practical experience, and I can develop that graduate through on-the-job training. And so he said, I can meet my workforce need starting from either type of graduate. And he said, as long as I have a candidate that I think has a capability to succeed in the field, I'm willing to do it either way.
One thing about employers is they're very willing to pay for further education if they have a good employee. So that's a real plus for people who might go ahead and get an associate degree first. Then they get a great job. And then their employer helps them get the degree they want them to have. And I guess I just want to make sure that we said we thought there's enough faculty, available faculty to absorb this in these community colleges, or available.
Well, I think
there's not a shortage of.
Well, as Lindsay shared with us, they often, because these technical supervisor programs are typically tightly linked to a local employer or a group of related employers, there is usually a pool of trained professionals. Now, they may need to do something. They may need to send some of them to get master's degrees or something like that. But I think that there are typically going to be solutions to teaching. These are also likely to be small programs. These are not going to be the RN to BSN with thousands of enrollment. I think at Brazosport, I don't remember the exact number, but I think it's between 20 and 30 per cohort.
The cohort started at 30 with each incoming class. They started with 30 current employees working in the field. They had the choice of doing a full-time or a part-time program, depending on their situation.
But that's not really going to meet our needs, is it, long-term?
There could be that, and it is geographically tied to the local community. So if you have other communities that need that upgrade of the workforce, then that would have to be, you'd have to look at each one of them to see if there's a sustainable number of candidates to sustain the program.
Just so you'll know, Gary was actually at Brazosport as the Chief Financial Officer when they initiated this program, so he has some very close. He spent a lot of time on this. But I think the real point was one Charles was making earlier, is compared with nursing, where you have a broad, very large number of people that need this type or potentially need this type of education. Here you have very, very much more job-specific, directly linked to potentially the employers in the area type of education. So and community colleges typically at the traditional levels have many programs like that, where they're very responsive to the local community. So that's not unlike what they do, but one couldn't necessarily say this program at Brazosport would translate to many other communities. Perhaps El Paso with the refineries there, the Beaumont area. But it's a very different kind of thing that I think probably almost has to be thought of in each area individually, and without these local connections. And I should say, my recollection, Gary, is that the universities in the area believe they weren't positioned well or had any interest in providing this particular type of a baccalaureate. They really encouraged Brazosport to do this.
The industry approached the universities in the Houston area to provide this program, and because of the small number and because of geographically they were 50 miles and students traveling back and forth, they were not able to work out an arrangement.
Well, and the industry probably wanted to keep it a fairly narrow scope, and that way they could really get the product that they wanted.
Yes, and that most of the technical programs in community college have advisory committees that are employers in the area that help the college design the curriculum to meet their need.
Thank you. Let me move on to fire science. Fire science actually has virtually an identical structure to what I just talked about with technical supervisors. The bachelor's degree in fire science is intended for middle managers or even chiefs of fire departments. So these are firefighters who have already been licensed. They will typically start their career with a certificate or an associate's degree. But then if they're interested in promotion, their employers may want them to have a bachelor's degree. Currently, about 40% of firefighting supervisors in this state hold a bachelor's degree. So it's not the majority, but it's a fairly close number. Fire departments told us that they have increased their preference for the bachelor's degree. That in years past, maybe it wasn't so important, but they recognize the value, and they would like to see an industry-specific bachelor's degree offered. The TWC projects about 300 openings for supervisors in firefighting per year. So to maintain the roughly same ratio, we would need to see about 110 new bachelor's graduates a year. This is a field where the demand is spread all across the state, and it's purely governed by population, because that's where you get your fire departments. So there's no concentration except to the extent that there's population concentration. There are no specific bachelor's programs in the state of Texas that do exactly this. There are a couple of emergency management, emergency services bachelor's programs that some firefighters do use. There are also the BAAS, Bachelor of Applied Arts and Sciences, sometimes have tracks in management and leadership that could be appropriate, and some firefighters do pursue those. We heard that a number of firefighters that want to advance are enrolling in out-of-state online programs because that's the only programs that are offered, and that they would rather have a fire-specific degree rather than one of these more general applied baccalaureates. One of the constraints on developing these programs is that the legislature has exempted firefighters from paying tuition in any courses that meet the major field of study requirements for a degree in the state.
So question, how much is the tuition for the online programs that they're doing from out of state?
I don't recall the exact figures, but the people we talked to said it's expensive,
Sure it is.
and they would greatly prefer it if the state would offer a public option to earn a bachelor's degree.
No incentive for any of our public schools to have the courses because they're not going to get paid.
That's right. So it seems fairly unlikely that universities would want to invest in developing these programs when they won't earn any tuition revenue. We did hear from some community colleges, though, that offer associate's degrees, that they said that they would be willing to develop bachelor's degrees, or at least consider it, and that they didn't see the tuition exemption as a fatal strike against doing it. The program, if a program's developed, it has to be an online program because it would have to draw statewide, and there are relatively small numbers of people who would enroll in it.
Don't most urban areas, I mean, to move into firefighting, they have their own academies, firefighting academies or whatever, and then so this would be more for somebody that's moving into management or supervision in fire departments?
Yes, that's correct. So this would not be the entry level credential.
Okay.
This would be for somebody who has already progressed through the initial certificate and through an associate's degree, and then is looking to move up. Right. So they might take their certificate could be earned at an academy. The next step would be to go to the community college to upgrade that certificate into an associate's, and then after that into a bachelor's.
So they have to have that before they ever get hired as a firefighter?
They need to have a certificate. They don't
is the
need
entry
the
level to
associates.
get.
That's
okay.
right. That's right.
Could you just clarify, you may have said this, but in terms of the baccalaureate, is the focus on primarily management skills, or are there things unique to firefighters at that next level?
It's a balance of management and leadership as well as advanced technical courses in, for instance, forensics is often taught in these bachelor's level curriculums. So investigation of arson would be something that you might not learn at the associate's level. And there is now a new national accreditor for fire science programs, and they've developed a model curriculum for the fire science baccalaureate. It's been only adopted by a handful of institutions so far nationwide, but that's an emerging trend. And that some of the institutions we talked to were aware of it, said that they would, if they did want to develop this program, they would really want to consider following that model curriculum and gaining that national accreditation. The last field we looked in depth at was health information technology. I think probably anybody who's been to the doctor or to the hospital has realized that medical records are becoming computerized, that the complexity of managing health information is growing very rapidly. And so the question's been raised, do medical coders or people who supervise them need bachelor's degrees? Medical coding is a field that's traditionally been taught at the certificates and associates level. What we heard in talking to the educational institutions and the employers is that this change is leading to new demands for highly educated individuals. But the demands are frequently at the graduate level. So they are actually so advanced that what they need are people with master's degrees who can fuse knowledge of healthcare and knowledge of information systems. And so the recommendations across the board were that undergraduate programs that would feed these graduate programs should be existing programs like nursing on the healthcare side or computer science or information technology, and then at the graduate level, they can be given additional exposure to bridge across these. And so there was almost no support expressed for developing new bachelor's programs in this field. So with that, if it's all right, I would like to move on to talking about more generally what are the benefits of expanding community college baccalaureate programs. So what we read in the literature, what we heard from our many interviews, is that community colleges are good at meeting local workforce needs. They're usually well connected. They have a tradition of being flexible with employers. We've already talked about that. Some employers said they would support community colleges because they thought community colleges targeted students who would be more likely to stay in their communities instead of moving to the big city. Community colleges are seen as expanding access, drawing in students who might not otherwise get a bachelor's degree. So far, the colleges in Texas have charged lower tuition than universities. They usually schedule the courses to meet the needs of working adults at night or on the weekends. At lower division, at least, they're typically open admission institutions, so they're drawing in a pool, and that students wouldn't have to transfer to a different institution and possibly become discouraged or face difficulties in transfer. Community colleges, of course, are very experienced in applied workforce areas, and they often have specific facilities that they've built for associates programs that could be used to teach bachelor's level classes as well. Many community colleges have small class sizes and often close relationships, and particularly if you think about a bachelor's program, which is likely to be a relatively small cohort, as Gary said, you can envision close relationships between the program faculty and the students, and that might confer some advantages. On the other hand, there are, of course, a number of challenges that are associated with community colleges moving in this direction. We heard a lot of concern about mission creep, that if community colleges start offering bachelor's degrees, that they will begin to shift their attention and their resources away from their traditional certificate and associate's missions. Bachelor's programs, as I'm going to talk about, typically come with higher costs than associate's programs, And if the community colleges can't recover those higher costs within the bachelor's program, they may be forced to raise costs or prices across the board. That could limit access. These programs, bachelor's programs, are unlikely to use open admissions. They're very likely to impose some kind of academic standards. And some people said that they thought that that was potentially incompatible with the open access mission of community colleges. We heard a lot about concerns related to duplication. Universities might offer programs that either overlap directly or maybe could target similar students. All kinds of competition you could envision. Competition for students, competition for faculty. We talked about that in nursing. Very strong concern. I think almost all the institutions raised that. Potential competition over funding that the state provides, and damage to the existing partnerships, which in many cases we heard were working well. I think important to note, there could be duplication, or not so much duplication, but competition, even in cases where universities don't offer the same kind of degree program. You see this particularly in these general BAAS university programs versus a more field or industry-specific Bachelor of Applied Technology that a community college might offer. So while Brazosport's doing a great job with their program and they've got good support, if they didn't offer that, maybe some of those students would take a more general management or organizational leadership curriculum at a university. Resources, infrastructure, and clinical spaces are also all challenges. Faculty are likely to be a challenge. Institutions are going to have to upgrade their accreditation. So if community colleges want to offer a bachelor's degree, they need to be reaccredited by SACS as a bachelor's granting institution. That's called a level 1 to level 2 upgrade. It requires a full reaccreditation. We heard a lot about the concerns that this would engender, and one of them is that SACS guidelines call for 25% of the major field courses to be taught by faculty with a terminal degree in the field. So some of the community colleges would have to recruit a number of doctorally qualified faculty, and that might prove challenging for them. What's interesting, I think, is to note that in Washington and Florida, which are the states that have moved most significantly, Florida now has, I think 28, if I remember my number correctly, community colleges which have successfully gone through SACS accreditation upgrade. And when we talked to them at the state level, they really did not see any significant problems. They said none of their colleges, they knew they all had to do things, and sometimes they had to expend resources, but it was feasible for all of them. And Washington, I think, has 8, maybe a few more now, and they also did not have difficulty with their accreditor.
So I read a couple of articles about the Florida situation where there were some community colleges who ended up with actually having terminal programs for nursing because they weren't accredited up front, so their graduates were not eligible to go on for a postgraduate degree. So is that something that anybody's recognized?
Yes, I think I've got that. Maybe.
So, I think that's a huge fear for someone who's going to, invest in this and then realize, oh, darn, by the way, I can't go get my master's. I have to stop because now this is a terminal degree. So, thank you.
Yes, that was a concern that was expressed. Under resources, we also have to be concerned about facilities. Many of the community colleges we visited said that if they were to go in this direction, they often thought that they had facilities that would be suitable, and they didn't see that as a particularly big need. Clinical spaces are an issue in nursing. In Houston and DFW, the majority, maybe all of the community colleges we visited, said that their associate degree nursing program are facing significant difficulties in maintaining clinical placements because the hospitals in those cities want to be magnet hospitals, so they need BSNs, and they just don't want to support ADN programs with clinical placements. I do think that's a significant issue for those programs. And those community colleges argued that if they could offer an RN to BSN track, that they thought they would have better success in getting clinical placements for their associate students because they could say, well, at least we offer the opportunity here.
And so on that point, what is there that prohibits those community colleges with partnering with a UT Arlington to offer that additional track such that employment could happen at the time of graduation with the associate's degree with the assurance from the employer that they would help to support that transition with this additional track? And I guess what I'm asking is there additional capacity within that? And why can't we partner and have literally one program that covers the entire state on a distance learning model that allows those individuals to stay in their community, to be employed in their community, move toward a desirable outcome that would allow magnet status for that rural or less urban hospital? Is that model been studied? And what are the barriers to that model being adopted?
Well, I think that's essentially how things work today. But what the hospitals in Houston and DFW told us, and according to the community colleges have told them, is that they really don't want to support associate's degree programs, even though they understand that that pathway exists.
The issue is the marketplace now has enough BSNs in those areas that they can normally hire a BSN. If the marketplace were short, they would go back to the ADN programs, and we did this in the past, a large hospital system. We hired people and said, in 3 years I expect you're going to have your BSN, and I'm going to pay for it, and I'm going to support you while you do it. But right now the marketplace in those areas, there are a lot of BSN nurses out there, and you can hire them. So that's what's happened. It's market driven. It's not necessarily just hospitals saying, we don't care anymore, but it's all about supply and demand. So but if the demand, the supply changes, hospitals will go back and they'll go, give me more ADNs, and we'll get them back to the bachelor.
Right, and so you recall where we were at about 8 to 10 years ago.
I do.
And this thing is going to shift, and then we're going to be caught flat-footed, not having prepared for that future need. And it seems to me that the low-cost alternative that would accomplish this for all involved, and I guess we are the coordinating board, so maybe we ought to coordinate a little bit on this, ought to be to build that capacity into the system so that when we get out of this glut of BSN nurses and it is looked at as being desirable, so the hospitals say, okay, we're going to scramble, take some associates and get them to the BSN status, that we've already built that capacity into the system.
Well, but I think we need to remember this. Hospitals are not the only employers here. There are a lot of employers out there that will hire an ADN nurse. The issue is everybody gets paid better if they go to the hospital when they graduate. So that's what graduates are actually saying. And the ADN programs are wringing their hands a little bit because they want to keep their student supply coming in because they train them in the big hospitals. And so nurses automatically want to go there. But there are a lot of employment opportunities out there besides the big hospitals for nurses. And so really that's what hospitals are saying now is this is the time to really supply nursing homes, home health, all these other places where patients are going to be now. In fact, the majority of patients are not in hospitals anymore. We have some nurses here that run clinics, and that's a huge part of what healthcare is shifting to outpatient. So I think for us to just make decisions based on hospitals is a little that's just a fraction of really the whole marketplace and the whole industry. But I'm I know what you're saying. My other point is why just use the UTA model? Why not use a competency model? Why do we have to say, you have to do 2 semesters, 4 semesters? Let's use a competency model to get nurses there fast, because you have a lot of nurses that are 10 years experience and they can do a competency model, get there faster, cheaper, and we've achieved our goal.
That is the future. That is the future. And not just in nursing.
And we did hear from some of the community college nursing chairs that we interviewed that because they're facing limited clinical spaces in the large hospitals in Houston and DFW, that they're looking to nursing homes, assisted living, and other community settings for placements. But there does, I'm not an expert on nursing, but there seems to be a preference on the educator's side to use the hospital as the clinical site, and I think it's because of the more intense experience that the nurse can get. Yeah, I mean, the point was made. We could place some nurses in a nursing home, but the number of procedures that they'll get a chance to do is going to be lower.
I'm not talking about the education piece. I'm talking about the employment piece. So,
Right.
yes, training in the hospitals is absolutely imperative. But graduates can find a lot of jobs other places.
And just to that, do you have an idea, Janelle, on what kind of percentage hospital, non-hospital? I mean, just a rough idea, or does anybody have that? Because I think it's a very important point.
New graduates, you mean? Well, I will tell you again, because hospitals have really, they know that there's a lot of value to holding on to their nurses. Retention is a huge number one thing that hospitals talk about all the time. So there are not as many openings as there has been in the past. And because of the emphasis, Dr. Tesher knows this, to go to outpatient care, because inpatient care is so expensive, move everything that you can to outpatient. There are more employment opportunities outpatient than inpatient.
That's what I would guess.
But the value of the experience inpatient and then taking someone to do home health who's had inpatient experience is what people really expect. So, but there are not going to be as many opportunities inpatient FTEs as there have been in the past. So, sorry.
The last point I want to make about resources is that if we're thinking about community college baccalaureate programs, it's very important that they be sustainable. Community college finances are not always so wonderful. So it's important that these institutions are taking on a mission that can execute sustainably. And one of the key variables in that is that they have a critical mass of students. So encouraging community colleges to start up a program that may have a very small niche market might not be in the institution's best interest, much less the state's interest. There are some quality concerns about teaching baccalaureate level education at community colleges. The faculty and other resources might not be of the same quality that the state universities can offer. There are concerns that employers might not perceive baccalaureates from community colleges as equal to university degrees. In some of the specific fields, as I mentioned, employers didn't tell us that, but it is possible that in some fields that would be the case. Many of the universities made a strong point to us that they offer a type of education that they just didn't see community colleges being able to offer. It's grounded in the liberal arts, it's based on research, and at a level of intellectual breadth that they just didn't think community college could do. And indeed, what we learned is that if community colleges implement baccalaureate programs, they typically implement them in a cohort model with a very tight package of courses. They don't say to the student, here are 32 electives you can go and take, and just take some of them. They say, first semester you're going to take these classes, second semester you're going to take these classes. It's much more efficient for them, so they can align their resources, but it does presumably sacrifice some degree of breadth that you would get in the university. And then there are also concerns about whether these applied baccalaureates in general will prepare students for graduate education. And I don't think that is primarily a concern about the community college as a provider. I think it's a concern about the applied baccalaureate as a degree and whether that is a credential that enables entry into graduate schools. I will note that we've just heard that this is a nationwide issue and that there are now some applied master's programs that are being developed precisely to provide some pathways. And I don't know kind of what the prospects are, but clearly people around the country are thinking about this. Let me make a few remarks about the options for provision and some information about costs before we get into the policy options. So, you've seen the three options that the state has. You can use the universities, you can use the community colleges, or you can have partnerships. What we found out was there are a lot of strong partnerships in this state, and it seems to be a rapidly growing strategy. Many of the partnerships that we heard about were recently inaugurated and that were a lot of enthusiasm. Some of these take the form of articulation agreements, so they're not necessarily joining together the two institutions physically, but they're saying, okay, you do this and we will take those credits at the university. Some of those agreements have guaranteed admission. Some might have dual enrollment. Some of the universities have become more flexible in accepting workforce education credits as lower division credits. There are also statewide initiatives to align curricula at the associate and baccalaureate level. Texas is a state that does not have strong statewide articulation structures. I come from California. We have very strong statewide articulation. There's common course numbering, and so a student knows if I go to any of the community colleges in the state of California and I take that class, I know it counts for a bachelor's requirement. And it's not the situation that you have here at the moment, at least, in Texas. But so some of these initiatives are trying to fill in that. Some universities are teaching on the community college campus. So the student does transfer her matriculation to the university. So the student is formally transferring, but can remain in the same location and take classes. There are also regional centers where community colleges and universities teach in the same location. Clearly, it's important to think about cost. Most of the information I've shared with you is about workforce demand and about provision options. I haven't really told you much about costs. It's actually unclear whether it's going to be more expensive to expand capacity at the universities or to build capacity at the community colleges. There are cost arguments kind of on both sides of the ledger. Developing new programs in particular always requires upfront investment. So the community colleges are going to have to, first of all, they're going to have to upgrade their accreditation from level 1 to level 2. We talked to the community colleges that have done it here, and we talked to some of the community colleges that have done it in Washington. They all estimated that the cost of reaccreditation and the additional resources that they had to put in place for accreditation was on the order of $250,000 to $500,000 in kind of one-time expenses to upgrade their accreditation. They also estimated that the typical new program start was in roughly the same range, so another $250,000 to $500,000 in startup costs for a new program. That's heavily dependent on what the existing resources are. There are community colleges that have doctorally qualified faculty. So if you are at that community college and you're starting the right program, you might already have a program director that you can have on staff and not have to go out and recruit. So it's, based on what we heard, it's plausible that a new bachelor's program could potentially cost as much as $1 million to start up if you had to get all the resources new. But if you could take advantage of resources, you'd see lower costs. There are a variety of reasons to think that community colleges have lower operating costs than state universities. And part of that, I think, is because of this tight cohort model, because they're just not going to offer the same breadth of curriculum, so they can be more focused, typically have higher teaching loads, and the community colleges would expect to maintain higher teaching loads even for the upper division faculty. On the other hand, we could have universities that have substantial capacity and faculty resources and might be able to expand at very low incremental cost. And I think the UT Arlington RN to BSN program is an example of that. It's a program that has a lot of resources. I'm sure there are some costs to expanding, but they may turn out to be low costs compared to starting up new programs. So that's about cost. Next question, of course, is who's going to pay those costs? And in the state of Texas, you have three major payers. You have the state, you have local taxpayers, and you have the students and their financial aid. Now, community colleges are funded mostly by local taxes and tuition. The three pilot community colleges received startup grants that covered their startup costs. Now, so far, those three colleges have received the formula funding upper division semester credit hour funding for their upper division courses. They've received equivalent to what state universities received. They've set tuition for the upper division at above the lower division rate, but below the state university rate. So they've kind of come in between. And we don't, I think Gary's going to do some more detailed cost analysis. But so far we talked informally to the financial officers and we asked them what they think, and that their thinking is that the current funding arrangements are adequate to cover the costs that they're incurring. But if you change the financial policies, that's going to impact these payers. In particular, if the state changes the reimbursement rate, that could cause the institutions to have to change tuition that students pay. And that could affect student demand and ultimately sustainability. So now with that perhaps quite long wind up, let's turn to the policy options. So first I want to report to you some happy news. We found very broad agreement among all the stakeholders on 5 important principles. First, meeting workforce needs should be the paramount consideration. Second, collaboration between 2-year and 4-year institutions is important, and that partnerships and articulation should remain a primary focus even if community colleges are given expanded authority to offer bachelor's degrees. We asked the stakeholders about program approval process. So if the community colleges are allowed to apply for bachelor's programs, does the coordinating board need to modify its approval process? Everybody said the existing criteria are entirely appropriate to evaluate community college bachelor's proposals. But the community colleges said they especially were concerned that the criteria, not the criteria, but that the process should be clear, transparent, and fair. That they should really know what they're being asked, how they're going to be evaluated, and that it should be very clear why decisions are made the way they are. Finally, when we asked stakeholders, they all pointed out that if the state wants more bachelor's graduates, and I think the state does want more bachelor's graduates, that resources are necessary. Whoever is going to provide increased capacity is going to have costs to do that. All right. So now moving away from the broad agreement to the options. The state's got 3 broad options. The first is continue the status quo. You've got 3 community colleges that can offer bachelor's degrees. And if you choose this option, we would advise putting resources into promoting and encouraging partnerships. Second option is allow community colleges to propose bachelor's programs without any specific limitations. Now that might sound really wide open, but you already have 2 important limiting factors. Any community college that wants to do it has to get SACS reaccreditation. So SACS is going to require that they have resources that are appropriate to baccalaureate education. And you're still going to have the coordinating board program approval process to review each degree proposal. So even if you don't impose any specific special limitations, you still have a substantial amount of control over quality and appropriateness of the program offerings. And then the third option would be to impose some additional specified limitations. And I'm going to talk to you about a number of specific limitations that you might want to consider. We'll group them into 4 groups. So there's a group of options that are related to statewide limitations. So these are kind of conceptual limitations. Then there are a group of limitations that relate to regional provision. Some options related to planning and monitoring, and then some options related to finance. And so I'm going to move through these, and then we can discuss them as you like. So, when you're thinking about policy options, what you want ideally are options that help you address the concerns that I talked about with the least amount of limitation to the benefits that I talked about. And you can see here on the chart, we've got the key concerns, mission creep, duplication, resources, and quality, and the key benefits, meaning workforce needs, expanding access, the applied experience, and the small environment. What you choose here are going to have an impact on how the 4-stage decision-making process will work. So let's talk about some of the options that are at statewide level. So one option you could choose is to limit community colleges to certain fields or degree types. And the legislation already specifies some limitations even for the study. So you could limit it to applied fields only. You could allow nursing or you could exclude nursing. And placing these limitations might limit some of the concerns about mission creep and duplication with the universities, but of course it's also going to reduce the fields that community colleges can serve, and so there might be some workforce needs that therefore community colleges aren't allowed to meet. Another option would be limit each community college that's authorized to a maximum number of programs. Currently there's a limit of 5. And the idea would be that limiting the number of programs would limit mission creep. It would mean that the community college would really have to remain focused on certificates and associates programs because they have a limited number of bachelor's programs. But of course, any kind of arbitrary limit is also going to limit the amount of workforce need that the community colleges can address, because once they reach their cap, then they can't propose anymore. So let's talk about regional options. So there's concern that universities and community colleges are going to have duplicate programs, or even if they don't have duplicate programs, they might be in competition for students or resources. So some of the other states actually require community colleges to provide formal notice of their intent to propose a program. In Florida, to file a letter of intent, and the universities have a period of time, I think it's 60 days, to express their interest and say, well, we'd like to do that. Having that kind of process in Texas might encourage the universities and the community colleges to partner, might give them an incentive to partner, or maybe universities will step up and say, well, we'd like to do that. But of course, any kind of process like this has a potential to slow down the development of new degree programs, because now you're imposing more steps. And also one of the things I think you want to watch out for if you adopt this is you want to make sure that if a university says, oh yeah, okay, we'll do that, we will make that program, I think you want to follow up, you want to make sure that they really implement it, that it's really serving the workforce need, because that would be the worst outcome, would be to have an alternative proposal approved and then it doesn't meet the workforce need. Gary's pointed out to me that the coordinating board, the state has a structure in the 10 higher ed regions where there are regional councils of universities and community colleges, and that those structures might be effective vehicles to coordinate or pre-coordinate these proposals. Another option is that if there is duplication of an existing program, that you require a higher standard of evidence that there are unmet needs. So for instance, nursing is a field that there already are programs in the state university. So if a community college were to propose nursing, they, under this option, they would really need to meet a high burden to show that they're going to meet a need that's not being met by the programs that exist, whether that's regional programs or the statewide distance learning programs. Talk about some planning and monitoring options. So another option would be to add some kind of quality requirement that goes beyond the current coordinating board criteria. One of those that's often mentioned is require community colleges to have a plan to seek national field accreditation in their program. And that might be a way of making sure that community colleges have a high quality program. It's not necessarily required of universities in this state when they propose a program, so it would be making a distinction. And in some fields, it could impose important limitations. So in nursing, we've already talked about, there's a reason that these RN to BSN programs aren't nationally accredited, and it's precisely because they don't want to spend the resources, in particular, to have to hire the number of faculty that they would need to meet those national requirements. This might not be something you want to do as a blanket policy, but there might be a consideration that you would put into the process. Another option would be to limit the number of community colleges statewide that would be authorized. So that might limit mission creep, and it might promote quality, because you could, if you wanted to, have a kind of competitive process where community colleges would seek this permission. And that's exactly what Washington State did. Washington State said, first, we're going to authorize 4 community colleges, and all the colleges that want this authorization need to put together a proposal and submit it. They convened a review board that had university members, community college members, and members representing the workforce needs. They reviewed all the proposals. They selected the 4 colleges that they thought were best positioned, and they authorized them. A few years later, they repeated the same process for another 4 colleges. And then recently, in 2010, they removed the limitation entirely. So today, there's no limitation and there's no competitive process, but initially, they expanded it through this process. Another option you could consider is requiring colleges to perform detailed self-studies for every proposal. Now, when they do their first baccalaureate proposal, they need to do a self-study because they're going to have to undergo reaccreditation, and they need to do the self-study as part of the reaccreditation process. But they don't have to do that after the first program. Now, at least one of the 3 colleges today has an internal policy in which they require equivalent self-studies for every baccalaureate proposal, because they really want to make sure that they have the resources, that the need is there, and that they have the resources. And so you could adopt that as a policy and says, we're going to require a higher level of study for these proposals, even though the criteria that you set are the same criteria. And of course, the disadvantage of that is it could delay or even discourage colleges from proposing those. There's a lot of concern about mission creep. There's a lot of concern about quality. There's not a lot of evidence about either topic. There's very little evidence about mission creep. Florida has been the most aggressive. In the 10 years they've had this policy, their colleges have developed 170 baccalaureate programs. Really quite remarkable number. And so on the one hand, that sounds like big shift. In fact, many of the colleges have dropped the word community from their name, and we heard a fair amount about the concern that that engendered in their local communities. Are you not the community college anymore? Now you're a state college. So that's a concern. But on the other hand, those 170 degree programs enroll only 6% of the students that attend Florida's community colleges. So on the one hand, it sounds like there's been this huge movement. On the other hand, 94% of the enrollment are still in the community college's traditional area.
How much did it cost them? Are they producing enough to really make a balance for the justification of the cost?
Well, that's a good question. There's actually a new study which we just got, I haven't read it yet, that did some cost analysis of Florida's programs. And what they found was, as I remember from the executive summary, that the cost per student is heavily dependent on the enrollment scale, as you'd imagine. So colleges that started small programs have experienced very high cost per student, much higher than state universities. Whereas if you have a large enough enrollment, then you may be able to offer competitive. So I think that does offer some caution in doing this.
I go back to John Conley's original charge to the board. We're familiar with it.
Yes. Florida also commissioned a graduate salary survey, which is very interesting. And you can look at the salaries by field and by community college versus four-year, and you can see that the employment rate of graduates is higher from the community college programs, and the salaries are higher. But I want to caution in interpreting that figure. Those are simply the average salaries and the average employment rates of the people who went through those programs. And the people who went through the community college programs probably were employed before they started the bachelor's program, and they almost certainly have more years of work experience. And so the authors of that study didn't control for prior employment and experience in comparing it. So I think we don't know whether the revealed quality of those graduates is equivalent. And I think it would be very important if Texas does move in this direction. I think it would be very useful, be important for Texas, and it would be a national contribution to commission some future research to improve the evidence base in this area. Let me talk about finance. I've talked about it a few minutes ago. So currently, the coordinating board is reimbursing community colleges at the same rate that state universities are reimbursed. You could consider expanding community college authorization, but lowering the reimbursement rate, and that would potentially change the decision-making at the community colleges. Washington, interestingly, has open authorization. Any community college can apply, but they don't provide any state funding to the community college. So if the community college wants to offer a bachelor's program, they do require the community colleges in Washington to charge the same tuition as a regional state university. And the community colleges said, we're able to run programs on that amount of funding without any state funding.
Mr. Chairman?
Yes.
Are the community colleges in Washington, are they funded with property taxes?
Yes, and they do receive state funding in Washington, but they did not make any adjustment. The state funding in Washington is a block grant, so it's not formula funding, and they deliberately did not adjust the grants when they gave them authorization to the bachelor's program. So the funding is loosely based on enrollment, but it's really based on the lower division enrollment.
Okay.
Yeah. Of course, if you cut the state reimbursement to the community colleges, they're going to have to seek money from somewhere else. Either they'll have to go to the local tax base, or raise the tuition that the students face. And so this is obviously a complicated trade-off to make. Finally, currently, the 3 community colleges that are authorized in Texas, the funding for their upper division credits is being taken out of the community college allocation. You could consider, or I guess the legislature could consider, taking some or all of funding away from the university allocation, or maybe, if it's feasible, allocating new monies, which I'm sure everybody would like. There's a concern, the current system raises a concern, because if you had a large-scale expansion of baccalaureate programs, from our interviews, we learned that there are many community colleges in this state that, at least right now, are not very interested in offering baccalaureate programs. And there are some that are quite interested. So what you could have is, if there is a big expansion among certain colleges and the money for that expansion is coming from the community college fund, then all the community colleges that don't decide to offer bachelor's degrees are going to see reductions in their state funding. And so that could cause concern about quality and resources in those places. On the other hand, taking it out of the university budget is surely going to exacerbate the perceived competition with the universities. We also identified a few supporting activities that would be very useful to pursue. The first is we heard a great deal of confusion over what a BAAS, BAS, and BAT are. Institutions appear to be using these degree terms in different ways. It must be confusing to students and to employers. And so may be worthwhile getting a clearer definition of the intent of these degrees, which would help students and employers understand what they're getting. If community colleges are authorized in the state to offer baccalaureate degrees, it'd be very valuable to connect up the experienced colleges with new colleges through mentoring or conferences so they can share experiences. We also think it would be a good idea to actually work on putting together a guiding manual for community colleges that are making this transition. That could be drawn from the experience of the 3 colleges that already have done it here, as well as potentially colleges in other states. We talked to some folks at the Community College Baccalaureate Association annual meeting, and there's quite a bit of interest nationwide in potentially participating in something like this. Finally, I mentioned the need for more empirical analysis, mentioned studies about graduate quality and mission creep. You also may want to conduct a cost study once there's a greater experience to understand how much it costs community colleges to offer this, and that might be an input in setting future reimbursement rates. Let me wrap up very quickly, reminding you that this is a growing nationwide trend. There are a number of other states have moved in this direction. Other states like Texas are also studying it. Texas has some experience. These kinds of degrees clearly offer some benefits, but they also raise concerns. And the, of course, difficult task that you face is to balance those benefits and concerns. Whatever you choose, you have to confront trade-offs. Every one of the policy options that I gave you has more of something and less of something else. There's virtually no way to chart a policy course that gets you only benefits and doesn't touch on any concerns. In the future, improving the evidence base will help. It won't help you today, but it might help your successors in the future, particularly around questions about mission creep. Something people are very concerned about and we just really don't have a lot of evidence on. So we yesterday presented this as a webinar. We are preparing a draft report, which you will receive. You will receive the draft report in time for the full board meeting in April. With your approval, the coordinating board will release that draft to the public for comment. We'll have a comment period. And then in time for your June committee meeting, we'll come back to you with a summary of the public comment that was received, with proposed revisions to the report as warranted, and continue the discussion about policy options. And the deadline for submitting this is August 1. So that means at the July full board meeting, we need to be ready with everything ready to be approved by the board to be transmitted.
Committee members, any additional questions? I know this was a lot of information, and Charles, thank you. It was a lot of very, very well presented, but gives us lots to continue to work on and think of, and still a lot of issues to work through. So while we have everyone here, are there any additional questions?
Yeah. Did it ever come up that the universities may try to get into the associate degree space, just the opposite of what we're actually studying here?
I don't think that ever came up.
We do have some universities that offer associate degrees currently. We have a couple.
You know what those fields are?
Sul Ross has a Farrier program. Midwestern, I had one, and Lamar had one at one time, but I don't know that they still do.
The legislature back in about 1987 specifically moved universities largely out of the associate business. That there were a number that were in that process, and on a limited basis, they felt that certain schools, because of their location, it's a similar type of question, had local needs that could only be addressed in, say, in the case of Sul Ross, there's no community college anywhere close to Alpine.
So I have a couple of just baselines that I make decisions on, and basically it's affordability, accessibility, and jobs. So I can see on some of these there, the firemen, okay. The nursing issue is obviously a huge one, and that's probably the biggest in the whole. I asked a lot of university deans, are you at capacity? Are you at capacity? Are you at capacity? No one said they were at capacity for RN to BSN. No one. Online, no one is at capacity. So I need a business case. Why, as a taxpayer, I would want to invest in a building and a faculty and a administration, and why would I want to do that if I don't have a real business case to invest heavily in that when I might get the same return with what I have now at a cheaper expansion cost? So I guess that's what I really need to know is there any way we can meet the needs without adding buildings and chairs and all of that? And the faculty issue is a huge issue. And are we really making a statement by just saying to colleges, oh yeah, go build some more buildings, and yeah, you need to do a few more of that? That's not the future. And really, that's not what I think our charge is. Our charge is really control cost, quality outcomes, make it accessible. And so what if we choose a community college? Yeah, they're all in the Metroplex, but you know, what about the guy out in Abilene? So I'm still trying to balance this with, I need a good business case to really do this, but I'm not offering more accessibility to, you know, the kid in Bangs, Texas, who could drive to Abilene, but you know what? He also has a computer. So I guess that's where I'm going to move forward with this. And if you got a good answer to my questions, we'll see it in it.
Anything else? Jacob?
Charles, did you say that the graduation rates and starting salaries went up in the one study that looked at Florida?
What they found in the Florida study was that the employment rate of the community college bachelor's graduates was higher than the university bachelor's graduates, and the salaries were higher. But as I said, that could very well be attributed to the fact that those are older students with more experience, and they may have probably already had jobs even before they entered the program. And we don't. I think Washington has done a study where they looked at just within the community college baccalaureate what the individual's salary was before they enrolled in the program and when they graduated, which is a somewhat different question. And that is, you know, are you seeing career progression?
I'd just like to say, outside of this particular context, when we've looked at salaries, we haven't specifically looked at, but we've felt that we need to look at the salary of the student when they enter the program, whether it's universities or community colleges, because that can be a factor at some schools. If, for example, I noticed some high salaries at University of Houston Victoria, and I believe it's because a large percentage of their students work as they're going through school and are probably very experienced. And if you look at that and compare their salaries to some of the campuses where the students are more likely to be in residence full-time, some of the salaries are higher, and we need to understand what contributes to that.
And you in Texas have wonderful data, so it's feasible to conduct a lot of those analyses here where it's much more difficult in some of the other states.
All right, Charles, we'll see you next time. Thank you very much. All right, moving along, we are now at agenda item 5B, which is consideration of adopting the Commissioner's recommendation to the Committee for funding formulas for use by the governor and the Legislative Budget Board in making appropriations recommendations to the appropriate legislative committees. We're going to have Gary Johnston, who's the Deputy Assistant Commissioner for Planning and Accountability, present. Dr. John Opperman, Vice Chancellor of Policy and Planning, Texas Tech University System. Mrs. Andrea Marks, Vice President of Business Affairs and Chief Financial Officer, the University of Texas Health Science Center at San Antonio. They'll present their recommendations to the committee. And then Susan Brown, the Assistant Commissioner, Planning and Accountability, and Gary Johnston, again, Deputy Assistant Commissioner for Planning and Accountability, will present the Commissioner's recommendations. So we'll start with this group, and I believe, Gary, you're going to be kicking off.
Actually, I'm going to go ahead and give you a little bit of an overview of some of the similarities and differences for how the funding formulas work. And some of you have been on the board for a while will get really tired of me saying funding in Texas is an allocation. There is a pot of money and it is allocated to the schools. It is not a budgeting factor. Institutions take that money except for very minor amount of it, and then they can spend it however they want. They do have, for debt service, for tuition revenue bonds, they have to spend that on the debt service. For the rest of it, they have full authority to put it wherever they want it. The process is we have the allocation. We make, along with the trustees, through their LAR, and the coordinating board, we make some recommendations on funding. The legislature makes the final decision of how much funding goes to each sector, and then through the allocation, through the formulas, determines how much money goes to each institution through the formula process. This slide just shows you kind of the process for what we've been working on. These committees actually started in August of last year. So everybody has been working very hard. You'll get the final recommendations. Will come to the April board meeting. We have to supply those to the LBB Governor's Office for June. We run some numbers, what we call the preliminary data run. In November, it goes to the LBB. Then in March, we do another formula run. Late April, May is when the final decisions are made, and that's when, in June, is when we actually find out how much money they get. So this is a long, drawn-out process. Similarities. All formulas are allocations. All formulas are allocations. Y'all will get really tired of me saying that, but they are allocations. Enrollment is the primary driver, even for those, well, except for TSTC, and we'll get into that a little bit later. But enrollment is the primary driver for all of them. That's one of the few similarities. Differences. Different methodologies. For the community colleges, it's based on contact hours, so number of hours that they're meeting with the students. For the universities, it's based on semester credit hours. For the health-related institutions, it's based on the number of FTEs. All enrollment-driven, just using different types. Community colleges, 100% of their formula is general revenue. For the universities, it's not all general revenue, and neither is it for the health-related institutions. There's also differences on what they're intended to cover. We'll get into that for each of them. And now Gary's going to take over and provide the recommendations from the community colleges.
Unfortunately, Chancellor Johnson Hadley had to leave. She had a call when she got here for a family emergency. And so I'm going to go through the committee's recommendations and in her place. The first slide really just gives you a picture of the sources of funding for community colleges. And as you can see, and I think we mentioned earlier, tuition and fees and local funds and federal funds, which is primarily the financial aid packages the students receive, is the majority of the funding the community colleges receive. Their formula by statute and by rider is intended to cover their instructional costs, the departmental operating expenses, and these are the eligible elements that they're able to use general revenue on. Currently, for this biennium, the community colleges, each one of them is receiving $1 million in base funding, and the remainder of the allocation is 90% of contact hour enrollment, and 10% is their outcome-based funding model, which we're calling student success. The student success points that the colleges earn, and this is based on a 3-year average, is they receive a point for completion of a developmental ed sequence. They get a point for their first college level course that the student completes in math or English with an A, B, or C. They receive a point for attaining 15 credits and then 30 credits at that college. And then they receive 2 points for a credential being awarded to the student, either a certificate or a bachelor's degree or associate degree. And they also receive 2 points when the student that has completed at least 15 hours at the community college transfers to a general academic institution within the state of Texas.
One point on that one is we are actually working with some of our institutions who use the National Student Clearinghouse to allow them to send us the data from the National Student Clearinghouse and include in that transfer rate those students who attend a college out of state. This is a huge issue for the colleges right along the border. And so we're...
The 2 schools is Grayson and Panola, right?
Yeah, we've worked with Grayson and Panola, and we've now opened it up to see how many additional institutions, because a lot of them do participate in National Student Clearinghouse.
As I said, for 2014-15 biennium, the total success funds points are determined on a 3-year average of 10, 11, 12. And we're proposing that there was a rider in the Appropriation Act this time for the coordinating board to come up with a model where the colleges measure the success against those 10, 11, and 12. Then in this next biennium, we'll be looking at 3 additional years moving forward, and they will be funded based on their increase or decrease in success funds, success points. And in order to do that, the recommendation is to allocate $172 million, which is the same amount this year, and that calculated to $185 per success point. And so in 16 and 17, in order for them to be compared performance in past to the current performance, the recommendation is to have that success point be funded at $185. And so if they increase their success points, they will get more money. And if they decrease, then they would get less money in their performance funding. We will, once we get the data in, the fiscal years will be 12, 13, and 14. Excellent. The proposed funding levels that the committee has recommended is to continue the core funding at $1 million, to fund the success points at $185, and to fund their contact hour enrollment portion at a rate of $6.12 per contact hour. Currently, that's at $5.29. Now, the community colleges are funded differently. The state colleges right now are funded differently than the community college, and the committee did not propose a change in that method. So instead of having 3 allocation models, the state colleges just receive their instruction and administration through an enrollment formula. So that rate that's being proposed is higher than the community college because they do not receive success point funding or the base core funding. So that rate is $7.97 is being proposed. Then the state colleges also receive infrastructure funding, and the recommendation is to have their infrastructure funding be comparable to the university's proposal.
Now I'm going to talk a little bit about this TSTC's funding model, which is totally different, and they are funded currently on what we call a return value funding model. We look at all the TSTC students who have completed at least 9 semester credit hours. Then we match that to TWC UI wage record data. We capture the earnings from that. We compare their earnings to minimum wage. So anything over minimum wage is considered value added because high school students have to receive at least minimum wage. We take that difference, we apply a discounting factor, and we also look at the value to the state, and this was actually information that we got from the state comptroller's office, which is 7% is what they value at the state. We apply that to the value added, which is the amount over over minimum wage, and we get a standard amount per graduate that they would get that would be return value to the state. That is split 60% to the state, or 60%, I believe, to the state, and 30% or 40% that would go back to TSTC, and that's how their amount is determined. Now, again, this gets back to where there's an allocation. The state did not fund them totally that amount, so then it's prorated between their 4 campuses. So that is the return value. We're not recommending any change at this time. This has only been in place for this current biennium, so we really don't have a whole lot of kind of information going forward. So we think it would be best to at least keep the same model in place for a couple of biennia to see what kind of results we're getting and see how they're doing with that. And TSTC is in full agreement on that. This is kind of just an overview of the recommended funding amounts for each of the 2-year college sectors. Like I said, because they're all funded a little bit differently, I wanted to provide this one slide. It said actually an increase of $251.5 million for all 3 of the 2-year college formulas. And now we're going to switch over to the general academic institutions, unless anybody has questions about the community colleges. And again, this is just a little bit different for the universities. Actually, part of their appropriations includes tuition and fees. So part of their tuition and fees are actually appropriated. That's the state portion. You will see another part of non-appropriated tuition and fees in the dark blue over there. So that's the designated. So you'll hear a lot about statutory tuition and designated tuition. Statutory tuition is $50 per semester credit hour. It's the same per everybody. So then the other part is the non-appropriated. That's what you'll hear it called designated. You'll hear it called board authorized. There's multiple terms for it, but that part is not appropriated. General academics, they are designed to cover the faculty salaries, library operating. They do get research enhancement. They get infrastructure support. So they are expected to cover more than the community colleges because community colleges don't really have a research component to it. Not intended, auxiliary services, football fields, all that. Mm-hmm. Fringe benefits, special items that you did on the pie chart that showed they do get a separate appropriations for special items. New construction, major repair, and debt service. And debt service is, again, one area where the money that they get for debt service has to go to pay off that debt service. It cannot be used for anything else.
I want to say briefly for new board members, in terms of you say certain fringe benefits, what fringe benefits type of fringe benefits are excluded?
They get prorated. So fringe benefits that go where a salary is paid from federal grants or a non-state portion do not get funded through appropriated dollars. Those have to be paid through other sources. So the fringe benefits along those lines are not covered through the INO formula part. General academics actually currently have 4 formulas. Well, 2 formulas, 2 supplements. We have instruction and operations, which is, you'll hear a lot about a cost matrix. That's all based on the cost matrix. Infrastructure, which is based on predicted square foot needed. Teaching experience, which is a 10% bump for undergraduate semester credit hours taught by tenure track faculty. And then we have a small institution supplement, which is there's a certain amount of funding that is needed to operate even for a small campus to keep your operations in place. And so that is designed to help with that. That has not actually changed in, I'm going to say 10 years, 20 years. It's been a long time. It's been a constant
Is that
amount.
a set percentage or a set amount?
It's a set amount. It's $1.5 million per biennium. And those are for institutions. That's at once you reach 5,000 square feet, and then now actually I guess it was 4 years ago, they changed it to where it's a prorated, so anything over 5,000 students, instead of, used to, if you had 5,001, you got 0. So you went from 1.5 million at 5,000 students to 0 at 5,001. It now tapers down. John's going to go over the committee recommendations.
Good morning. I'm John Opperman. I was chair of the Formula Advisory Committee for the General Academics and would like to present our recommendations. The Commissioner's charges to us, the first will be covering is competency-based education and how that should be funded. In our discussions on this issue, it was clear that there are a lot of institutions that are still exploring this issue and trying to figure it out, and there's different approaches that are being taken. So from a funding perspective, the committee felt that to the extent that you take an approach which can be converted to semester credit hours, then those would be funded based upon the 16-17 biennium recommendations in the current formulas. Beyond that, I think it was felt that because our current funding formula is cost-based, that we really needed more cost information regarding these particular type of programs to determine what an appropriate funding level would be. We wanted to, obviously we would like to have incentives for this to encourage institutions to go further down this road. On the other hand, we don't want to over-incentivize this because it is a new area and there are a number of issues that have to be resolved. So the recommendation was that the coordinating board conduct a cost study of these programs and report back to the next Formula Advisory Committee for further review. The second charge we're looking at is the charge on outcomes-based funding, one that we're becoming very familiar with now. It's been 4 or 5 years, I guess, we've been working on this. The recommendations of the committee are similar to what we did 2 years ago. One difference is that the recommendation of the committee is to fund this outside the formula as an add-on to the formula. Last time it was inside the formula. In our recommendations, we're also recommending that that the legislature fully fund the I&O and infrastructure formula first, and then this would be on top of that. It is an allocation formula. It's based on 7 metrics, which we'll go over here in a minute. The data is based on a 3-year rolling average in the latest data available. It is scaled to compensate for the disproportionality between the points generated from each of these metrics. And then it's weighted, and the recommendation of the committee is to have each institution weight its own metrics based upon a set of parameters that are set. If you go to the next slide. These are the metrics that are recommended for the model. Actually, all of these were in the model from 2 years ago. We did drop 2 of the metrics from last time. We had a metric last time for cost-weighted degrees. That was rather complicated to try to explain to the legislature. And also, when the data was updated for this most recent biennium, some of the effects of that cost weighted metric sort of got washed out anyway. And so the institutions that had thought it was really important last time didn't see it as important this time, and we dropped that metric. The other metric we dropped was a metric we had for critical fields to reward degrees in certain critical fields. There had always been, since we first looked at that metric, there has been some concern about it because it was based upon an old study done on critical fields. But in addition to that, in this most recent round of hearings, we did have Dr. Trey Miller from the RAND Corporation give us some background on what other states are doing around the country on outcomes-based funding. And one of the things he pointed out is that this critical fields metric actually was unique to Texas, that there really wasn't anybody that had a metric like that. And one of the concerns, I think, going through the legislative session last time was the differences in mission among institutions and how this formula deals with that. So I think the other concern about critical fields is that that's a particular metric which actually enhances the differences among mission, because two of the driving forces in that particular metric were nursing and engineering. Well, if you don't have a school of engineering, you don't have a school of nursing, you really can't do anything about that metric. So we, again, dropped it partly because of that mission differentiation issue. These metrics, as I said, were the ones that were listed last time: total undergraduate degrees, which is the basis of just about any formula you'd use. Then looking at total undergraduate degrees adjusted by a 6-year graduation rate as an incentive for institutions to increase their graduation rates. Total undergraduate degrees per 100 undergraduate full-time student equivalents, which helps to resolve the issues between large and small institutions. This is a very important metric for our smaller institutions. Then degrees awarded to at-risk students, as defined here, and this again this has also been an area where the committee has spent a lot of time looking at this. We did so 2 years ago as well. This is actually based on a federal definition of at-risk, and it's fairly standard. But I think there's still some feeling it's a very broad definition of at-risk, and I think there was a recommendation that the coordinating board continue to look at this issue and see if there are ways that we can refine the definition of the metric for future consideration. And then finally, the retention metrics for completing 30, 60, and 90 hours of coursework on that your campus. The next slide. This is just an indication of what the 7 factors are and the way they are scaled in our recommendations. If you were involved 2 years ago, the scaling that was done in the model was really sort of left implicit. I think Paul Turcotte probably, he kind of made the best determinations of how to do that. This time we looked at it in a little bit more detail. As you can see, the degrees adjusted by graduation rate and degrees for at-risk students are the ones that are weighted the greatest. And I think the way that came out is partly because these are sort of the 2 competing factors in looking at the differences of institutions across the state. And so that when we weighted these more to sort of reflect those competing interests, weighted them fairly closely. If you look at the amount of money being driven in the model, and the recommendation was 10%, which is about $235 million in current funding, these 2 metrics are driving about the same amount of money in the model. I don't think anyone on the committee believes that this is necessarily the exact right scaling. I think the only way you get this right is through some experience and seeing how institutions respond to the model itself. So we would expect over time that this might be something that would be adjusted, as the weights for the institutions might be adjusted as well over time. Next slide. Okay.
I have a question.
Yes.
Quickly. Why was the graduation rate less than at-risk, the number of at-risk students? Do you know?
There becomes a point when, one of the questions when you're developing a model which is brand new is what's the right starting point? And I think in the discussions that we've had, there's a lot of difference of opinion about that. There really is no right starting point for funding amounts. So the decision that was made 2 years ago and made again this time is that the funding amount should be as close as possible to current funding levels, and then allow institutions going forward to respond to that, and in which case funding amounts could diverge over time, obviously. So the model is adjusted, the scaling is adjusted somewhat to limit the amount of redistributions taking place. And there were certainly people on the committee that felt the at-risk number should be higher. But by the same token, in terms of trying to defend that, there was really no basis for it. So, and we spent a lot of time looking at what Tennessee did 2 years ago. They did basically the same thing. They felt like the right starting point was very close to their current funding levels, and then allow institutions to move beyond that.
Thank you.
Okay, the funding recommendation. Oh, I'm sorry.
John, on the outcomes-based metric, we have total undergraduate degrees and then the undergraduate degrees adjusted by the 6-year graduation rate. Institutions vary by how many transfer, like from a community college into a university. And I don't know, but I'm assuming like a UT or an A&M would have more students enrolling as freshmen that actually graduated compared to a UTEP, for example, that might have a lot of transfers. So in that second metric there, third, the total undergraduate degrees, the second one, the 6-year graduation rate. So then a university that has a transfer student that ends up graduating, they would get the total undergraduate degree would be included as at the 1.6, but if they didn't start there as a freshman where it's 30%, then they just get nothing.
Well, for any of these metrics,
for that metric.
For any of these metrics involving total degrees, if it's a transfer student, you get the full credit for that student, whether they're there 2 years or 4 years.
Okay. Thank you.
And in fact, that's one of the incentives, I think, for accepting transfers is that you do get full credit for it.
Okay. The funding recommendation, which is actually in the report that was given to you, and the slide was somehow left out, is to have an increase of $281 million, which is actually 6.4%, and that is their formula increase amount. That's the inside the formula, and then as John mentioned, it was the $234 million would be the recommendation for the outcomes part of it. And that is split between the infrastructure and the I&O. So that's the total formula amount being recommended.
Right. So the total recommendation of funding for the general academics is basically $281 million increase for I&O and infrastructure, and then an additional $235 million for outcomes funding on top of that.
Can I ask how that relates?
How does that relate to putting us back to where we were when the reductions were made back a couple sessions ago?
Right. In fact,
putting us back to about a third to where we were.
Well, this gets us to $57 on the I&O. It'd be $57.30. The 2011 rate is $62.10. So it gets us a little bit more than halfway from where we are now to that 2011 rate. And in fact, the committee's approach in coming up with the recommendation was to get back to that 2011 level, but do it on a phased-in basis because it was a big jump. Obviously, go all the way to 62.10. So this anticipates that this would be phased back up to that 62.10.
I may have. Oh, you're not quite done yet. I'll wait till you.
No, I think I'm.
This is it for the general academics.
Okay. So I know this is coming from the the advisory committee. And was this posted publicly and asked for comments?
It's an advisory committee, so we do not take testimony as an
Well, I
advisory
mean,
committee.
online where they're
It was posted for the board.
Only.
We will be getting comments. It doesn't go, it goes before the full board, so people have all sorts of times to comment on it. Pretty much everybody was aware of it. I mean, all the governmental relations people show up to the meetings, and so they pretty much know what's going on. We are actually planning to have a webinar in the next couple of weeks to make sure that everybody is clear on how we're doing the outcomes-based funding, so that they can comment on that at that time.
Well, you know, we've done some of this before, just asking if there's any big pushback, any barriers, what is, you know, the risk of moving forward?
You mean from an institutional perspective?
Stakeholders.
Or
Stakeholders.
from stakeholders generally? It was not a unanimous vote for this.
One group in particular?
No, you know, it was different. Coincidentally, they were all from Houston, but that was just a coincidence. I think, I mean, there's not anybody that walked away from this thinking this was great. You know, we know we got it exactly right. Because it is an allocation formula, and I think we can use the current INO formula as an example, it took a number of years before we got the kind of support for that model that we have now. It was, 10 or 15 years ago, it was not uncommon for legislators to hear from their institutions that the INO formula was unfair.
Or even last year.
Well, there are still complaints about it, but not nearly to the extent that it has been in the past. So I think this is a similar situation where it's going to take some time to get it right. We're recommending that this be phased in. As it turns out, the way we were able to get to the final recommendations, there would be no hold harmless or set aside required for any of the institutions, but the decision was to phase it in where there'd be some limitation on losses if they were to occur in order to give institutions time to respond to it. So in that sense, I think the institutions are comfortable that it's evolutionary, and we will continue to refine this model as time, and they're being given time because of this phase in to deal with and figure out how it's going to work and how they can respond to it. The opposition in committee really was from those who still felt like there were alternatives to this, and there may be. I think there are things that a group of us will work on. I can tell you that, and based on our discussion with coordinating board staff about this, it will take a long time, a good deal of time to get to that point if there is an alternative. There are some issues with it. Essentially, the difference is that in the allocation model, everybody's competing against each other. So the question is there a model where institutions compete only against themselves? And theoretically, yes, but in trying to put something into practice and then figure out how the legislature appropriates money for that purpose, there are a lot of complications to it.
So you're telling us there are no big potholes for us to be aware of?
Depends on how you define a pothole.
I think he's telling you there are only potholes.
Well, and maybe we just, I personally just feel like I need some more specifics on that, basically. I mean, I'm not, obviously, you've put a lot of work into this, and you're never going to get 100%. I'm not surprised it wasn't unanimous, so, I mean, but if we need to know about any potholes, I would assume that you'll let us know going forward.
I think from this point in the process, you'll probably find out before I will.
We will be working, as John mentioned, there was one model that came forward at the last meeting, which was in March, that would require it would probably take us at least 2 years to develop that model. It was where each institution would set their own metrics and set their own targets that would be yes. So that was not something we thought would be feasible in the amount of time that we have. And so we are bringing this one forward. We have told the institution that brought that forward that we would be glad to continue working with them on what possible metrics and how that could possibly work. But having gotten that in March makes it a little tough to have it ready for y'all to see in March. So we're still working on it, and we're still, looking at what might be possible for the at-risk category. And so we're still working with them, and we're able to run all sorts of. My staff is going to shoot me, but we continue to run different formula runs as we go forward because everybody wants to see the numbers.
What do they look like?
And so we're continuing to do that. It's not like that has totally stopped, and if we get to an aha moment, we've got it all figured out, we may actually ask that the committee come back and look at that. And John's going to shoot me now. So he's been on the committee 4 years now, and he's probably done.
I'm here to serve.
He has put a lot of work into this.
Yeah, the alternative model put forward at the last minute by just a small number of institutions, aside from what Susan said, one of the criticisms from other folks was because of at least the initial proposal that each institution be able to sort of identify their own metrics, not necessarily within a pool of existing metrics, and that wasn't clear, it would make it even more difficult for institutions to know what to do on their part because it just added more uncertainty to the model. The other thing I think, and John, maybe if you disagree with this, please say so, but it sounded to me as though the institutions at least represented on the committee realized that it was important to move forward with some type of outcomes-based process, and they're struggling with it. But I think everyone would agree this isn't perfect at this point. But I do think they recognize that something they needed to recommend something that made sense to them at some level, but recognizing they would have to modify it going forward.
Yeah, I think the committee, and this was true 2 years ago also, felt like this is a path that many institutions around the country are on, trying to figure this out. I will say that, especially when you look at other states, one of the difficulties we have is that first of all, we have a large number of general academic institutions, and that makes it more difficult because there's a very broad range of mission there and other characteristics which don't have anything to do with mission. The other thing I think it makes it difficult here is that we're a highly decentralized system in Texas. And in the states where they've had the most success, they tend to be more centralized. So it makes it easier to implement something that's new and different. So those are the kind of things we have to deal with.
And I will say At Your Place is a outcomes-based formula recommendation that does go into a little bit more detail about just the outcomes-based funding portion of it. So it was developed yesterday, so.
While I have the opportunity, I'd like to thank the staff, the coordinating board for helping us through this process, and especially Paul Turcotte, who did a lot of work to help get us to where we are today.
We want to thank you. This is not an easy process, and I know some of the dilemmas that the committee's had to deal with, and we certainly appreciate, John, not only you, but everyone else that served on the committee.
Thank you.
Okay, now we'll go ahead and move on to the health-related institutions. Again, this shows that the health-relateds also get appropriated some tuition and fees. One of the things that may surprise you is that also some of their hospital and clinic patient care dollars are appropriated. They have some that's not and some that is. And so that's something that I think does surprise a lot of people, is that some of that is appropriated, even though it's money that they collect outside of tuition and fees. And they have five, well, I'll let Andrea go ahead and talk about these.
Thank you, Susan. I'm Andrea Marks, and I served as the chair for the Health-Related Institutions Formula Advisory Committee. The health-related institutions are supported by 5 formulas. There is an instruction and operations formula intended to fund just that. It represents 77% of the overall formula that the institutions receive. There's also 4 other formulas. The infrastructure formula is about 18%. That's derived based on an institution's square footage, their state-supported FTSEs, their research expenditures. There's a formula that generates the amount of support that should be provided for infrastructure. There's also a research enhancement formula that's primarily driven by an institution's research expenditures. It's intended to support research on our campuses. That represents 5% of the formula. The infrastructure formula is actually 18% of the total formula. There are 2 other smaller formulas, mission-specific. Those were formulas that were dedicated to specific institutions, MD Anderson and UT Health Center Tyler. Both have mission-specific formulas that are tied to the INO formula. So if there is any change, you'll see in the report that whatever we recommend for the instruction and operations formula, legislatively driven, we're required to make any adjustment to the mission-specific for those 2 institutions. They are primarily patient care institutions and don't have a large volume of medical, dental, health-related degree programs. And then the graduate medical education formula, that was added in 2007. All of the formulas, the 4 formulas I described, were put in place in 2000 for the 2000-2001 biennium. The graduate medical education formula was created in 2007 to address the need for providing residency programs, supporting the residency programs that our institutions provide. That formula actually is a very small percentage. It's about $54 million for all health-related institutions. The total formula generates $1.7 billion in funding for our institutions. If I could just speak a moment about the INO formula, there's information in the report about the weights. The programs are all weighted differently. There is a rate that is calculated for the INO formula, and then every discipline has a weight that gets applied to that rate. So an allied health student is the base at 1, and the weights go increasingly higher up to more than 4.5 times for a medical student. So for educating a medical student, we get 4.7 times the funding that we get for an allied health student. If we'll turn to the recommendations, the committee made no recommendations to actually change the structure of those formulas. Unlike the general academics, we did not have a debate around the weights or the 5 formulas that currently exist. We feel that those weights are appropriate, and our main concern was the rate. And we believe that the health-related institution should be supported by a reliable standard rate. The rate in 2000 and 2001 is what we're targeting. When the original formula was created, the rate was $11,383 per student. That was the base rate. Currently, in the 14-15 biennium, the rate is $9,527. And so we believe that we really need to get back to that 2000-2001 rate. We have grown enrollment. We have increased our research expenditures since that time, but the funding per student goes down. The recommendation that we made, while we understand getting back to the 2000-2001 formula will be significant, we've recommended that we do it in phases. We have actually made this recommendation several times now since the 2007 Formula Advisory Committee report. We have recommended a phased-in approach to get us back to those rates, and we want to stay consistent with that message to close the gap in the rate. We understand that the cost is significant. You guys have spent a lot of time earlier today talking about the healthcare workforce, primarily as it relates to nurses. we believe that the investment Texas makes in the healthcare workforce is critical in educating that workforce, not only to produce the workforce, but to produce the faculty. The health-related institutions produce not only physicians, but nurses, dentists, physical therapists, PAs, all of the many health-related professions that are going to be increasingly needed. The lower-cost health providers are going to be needed in the workforce for the future. While Texas has added physicians, we are still low in our rankings in the number of physicians and in the number of dentists and in the number of nurses, as you've already heard. So getting to our recommendations, the overall increase is $481 million, or 27%. We recommended an increase in the I&O formula that would get us back. It was a 21% increase for I&O. Again, that's primarily the formula that generates the most funding, but the other formulas are also critically important. Infrastructure and research are very important to our campuses. While the recommendation is to increase infrastructure by $130 million and research by $42 million, those percentages seem high, but those particular formulas suffered a larger percentage decrease in the last reduction, 40% and 57%. So our request seemed relatively higher than what we were requesting in the I&O. For GME, we're requesting that while there was no formula rate in 2000 and 2001, we're asking that we get the same percentage increase for GME. I think that's
okay. The commissioner's recommendation for the health-related institutions is slightly different. Instead of the 21% increase for I&O, because they did get a larger increase than the other sectors from 12-13 to 14-15, the commissioner is recommending a 16% increase and not the 21%. He's recommending that the infrastructure and the research enhancement actually goes back to the base of 08-09, which was before the big cuts in 10 and 11, but it's not back they weren't as high as the 2000-2001 rates.
What are those in a percentage?
For the
Page 8.
Page 8.
We requested a 52% increase in the infrastructure formula, and the commissioner is recommending 25%.
That's what I was looking for.
Yeah. And then for research, we're requesting 62%. Again, it seems high, but the dollars are lower. The impact was greater in terms of percentage in the cuts to those formulas. And the commissioner is recommending 23% increase to the research formula.
Now, the GME, because it's a new formula, and we understand that we really need to increase the GME, that's been very important to the board and to the state, that we're sticking with the committee's recommendation on that increase for the GME formula. So the total increase that the commissioner is recommending is 18.2% for the health-related institutions and not the 27.4%. If you'd like to see a summary on page 3 of the report, there's a summary of all of the sectors. So the general academics is 6.4%. The TSTCs is 3%. Public state colleges, which is the Lamar State Colleges, their 2-year colleges, is 13.2%, and the community colleges is 13.8%, which comes out comes out to a 10.6%. Now, this does not include the outcomes-based funding, which is $234 million for the general academics. So that would actually bump it up. Instead of a 6.4% increase, if we were able to get the full formula funding plus the outcomes-based funding, it would put them at a little bit over 12% increase.
Question. So are you asking us to have two different votes, one for general academics and then one for the healthcare related?
You can either do it all as one, or you can do it separately. It's totally up to y'all.
But the commissioner's recommendation
It would be
on general academics is different than the
for
advisory?
the general academics. The commissioner is in line with the
Same as health.
same.
I just
It's
want
the
to
health
clarify.
related that is separate.
I believe there
Different.
should be two votes.
I would agree.
Okay.
Okay.
So I'll make a motion to approve on, my motion is to approve the general academics recommendation.
Okay.
All right, so we have a motion and a second discussion.
Yeah, just so I'm clear, I've been reading the materials on page 7 of the formula funding recommendations. It was my understanding that there was going to be a meeting with the commissioner on the 20th.
There was.
And from that meeting, the commissioner has adopted the recommendations from the committee?
Yes, yes.
He's concurred with that?
He has concurred with the recommendations of the committee.
So by voting in favor of this, we would be supporting both the committee and the commissioner's recommendation?
Correct.
Okay, thank you.
Any other discussion? All in favor of the motion, say aye.
Aye.
Opposed? Thank you. It passes.
Okay, we also need a motion on the two-year colleges and on the health-related institutions.
On the two-year colleges, the commissioner agrees with the advisory committee?
Yes, he
So
does.
I move we accept that. On community colleges.
On community colleges, we have a motion and a second to approve the commissioner's
We
recommendation.
make that all two-year colleges?
All two-year, I'm sorry. Apologize, there is a terminology. Yes, sorry. All two-year.
Get that straight.
Correct.
Any discussion on that one? All in favor, say aye.
Aye.
Opposed? Thank you.
Okay. Now the health-related.
Now,
Now the health-related.
And the commissioner's not here. You want to call him?
I can tell you the logic behind it. Oh, he's currently testifying. He is. I don't think we ought to interrupt.
no, don't bother now.
The thought was that both of the other sectors had kind of accepted that we're not going to get back to 2000, 2001, and that getting back to the 08, 09, which is before the big cuts that we had in 10 and 11, was a reasonable request. And so that is why it was, let's try to get back to the 08, 09 biennium. And so that is where, as I said, he did accept their full proposal for the GME, which is a 38.9% increase for GME funding. So that is that's where the thought process was, that 27% when you're asking for 13% and 6% for the other sectors, coming in and asking for 27% might seem a little unreasonable. And so.
Still at 18.
So here's my question. So where were we ranked among other states in 2000?
Compared to what?
Yeah.
Compared to healthcare, and Dr. Tesher, you may know these answers, we still are not even at the middle of the pack.
No, but I don't know that we're at the middle of the pack for the
Right.
other sectors
Right.
also.
Are you talking about physicians per capita?
For
Total funding.
total funding and healthcare and education and meeting the needs of the population.
We're just a lot more efficient in Texas.
I'm asking the question.
And I'm afraid I don't have the answer to that one. I would say we were probably below the other states, and we continue to be somewhat below.
I would think that's true without looking
So
at it.
meeting the needs of the state, where are we now?
I don't have the 00 numbers. I do know that from 2011 to 2013, in per capita physicians, we went up from 48th to 47th in the nation. And we did go, that was for primary care physicians. For total physicians, we went, and this is based on data from the AAMC, it's contained in your report, we went from 46th to 41st, which was a 5 jump. So we're, and from a health-related institution, we feel like we're making a dent. You have lots of schools like that are expanding enrollment, trying to produce more physicians. You know, the UT system is adding 2 new medical schools, but it's too slow. This move of the curve.
And this funding does not include the addition of 2 new medical schools because
Correct.
they won't be online at that point.
Correct.
So there will be increases, and there would need to be a special item to fund those.
There is a special item currently for the South Texas Medical School that's been in place since the 76th legislature, I think, for the RAC at the Health Science Center San Antonio, which is my institution. The UT Austin Medical School is being supported by funding from the Board of Regents initially, but eventually will be in these formula.
But neither of those
draws.
new institutions are
Correct.
in the formula. Neither, so that is, they're not in there right now, and they would need to be added.
Would this recommendation by the advisory committee lead to the increase in the, say, next year or the year following's class size at the existing medical schools of MDs?
I think it
medical
depends on
students?
the institution. Overall, I would say yes. There are some institutions that are at capacity. My medical school, for example, is expanding to increase the South Texas contingent cohort of medical students. There are other schools that are growing more rapidly, like Texas Tech and UNT medical schools. But a school like Southwestern is at capacity with the number of medical students that they're producing. Other healthcare workers are being expanded. Public health, nursing, our nursing school has increased the number of graduates over the last 5 years, almost by double.
Susan, the commissioner concurs with the GME formula.
Yes.
That's a very small portion
It's
of
a
the
very
formula.
small, it is 75 million.
Okay.
Is the recommended amount is 75 million.
Okay. But in the overall picture, that's a very small piece of
It's
the...
a very small piece of it.
Right, the increase is 21 million that we're asking for.
And GME is critical, we know, not just for our own graduates, but bringing graduates from other states, and it's going to be even more critical as we bring more medical schools online. That formula has a real impact today.
Well, and I'm just thinking we have to strengthen our medical centers to get them even to the
Yes,
point where they can
right.
support more physicians or graduates or residencies or research. What if we asked for the amount the advisory board is asking for? Then we know we have 2 more medical schools that are eventually want to have part of the pie. I mean, all they can say is no. I mean, it's up to the legislature to come back and say, okay, you can have this much. But I think we go for the gold. We say this is where we need to be in order for us to begin actually making strides so that we're not always at the bottom of the barrel on this.
I can't speak for the commissioner directly. I think part of the concern is we've heard 3 formulas here. Mm-hmm. There is higher ed money, period. Now now each will seek their own money, but how much money will be available for higher education in general? We do have additional medical schools coming online, which are going to clearly place more demand on higher education funding, and I think there clearly is a dilemma that the state's going to have to face.
You know, we did a fairly extensive study on this about 1.5 years, 2 years ago, and I spent an hour on the phone yesterday with the folks at CMS, and the Medicare funding formula for GME is frozen. It has not changed since the Balanced Budget Act of 1997. And so you have states that are in high growth such as ours, who really cannot access additional full-time equivalent slots. These FTE training slots are essentially the funding goes to the hospital. The hospital then decides we want to train people in this discipline or that discipline, but it goes to the hospital. A lot of that money has continued to stay in states that are not in high growth mode, in those that had expanded their GME offerings throughout the 80s and 90s. So that's why you see a disproportionate number of those training in GME in the states of New York and California, just to name two, whereas you have high growth states like Florida and Texas who have not been able to unlock the formula. And the problem with unlocking the formula is that you can't wave a magic wand at CMS and say, CMS, you see the disparity, you can do this. No, they're regulated by statute. So you have to go back through the Congress to do that. That's been the problem that we've had. And this state, to their credit, and the legislature, to their credit, stepped up and made some pretty major fundings based upon our study and our recommendation for that. I think that this is a good start, and we're going to have to do more of that. I'm a little surprised that the recommendation didn't have more of that within the GME sector, but I am heartened that the commissioner recommends concurring with the full GME funding recommendation, and I understand that there's limited resources. So I think that there's a lot of factors going on here, opening of new medical schools, but we really can't get our focus off of graduate medical education, because when we have GME slots in this state, we retain our medical students, they train in our state, they stay in our state. We've proven that conclusively. Texas is probably at the top, if not the top, at retaining the investment it's made in its undergraduate medical education, the UME, as well as the graduate medical education. So that's the force multiplier. It's going to take us a generation, literally, to change this. There's really no good studies, and I continue to look at this and talk to national leaders, including the AAMC, which is the American Association of Medical Colleges. How many internists do you need to service a population? How many orthopedists do you need? They don't know. There's not a solid number. All we know is that we're in the lower end of the spectrum. But remember, we're chasing an exploding population. So there's a numerator and a denominator there. And yeah, the numerator is getting higher, but the denominator is exploding past that with our population. And I don't recall, but someone was telling me something like 1,200 people moved to this state a week. I mean, we are experiencing explosive growth. And not all 1,200 of those are physicians. Now, some of them may be coming, and that's the good news. But in my communications with the medical board is that they are seeing an increase in applications, but they're also seeing a decrease in the number that are accepted and given a new license and transfer, which to me means that they can be a little more picky in the quality of folks that they're bringing in. Generally, these people who have already trained somewhere else at somebody else's expense, yay, who are bringing expertise into our state. So I think that the short answer to all this is going to be a multifactorial situation that we have to solve in various ways. And I think I can support the commissioner's recommendation. So I guess I would make that in the form of a motion that we support the commissioner's recommendation on this.
I have a motion to support the commissioner's recommendation. I have a second. And we have a second. Any discussion at this point? Additional discussion? All right. All in favor of the motion say aye.
Aye.
Aye. Opposed? So 1, 2, 3 to 2. The motion passes. Right? All right. Thank you.
Thank you very much.
Thank you all very much. Appreciate it.
Andrea, thanks for the work you and your committee did.
It's our pleasure.
Thank
you very much.
A lot of great work.
Thank you.
All right. Moving on. Agenda item 5C is consideration of adopting the Commissioner's recommendation to the Committee for the Annual Report about the financial condition of the state's community college districts. Senate Bill 183rd Legislative Session, Regular Session, Rider 13, Section 3203. Gary Johnstone, Deputy and Assistant Commissioner, Planning and Accountability, is available to answer questions.
If I could, just to briefly, I just wanted to say this is our third report that we have produced since that rider was added. The rider, in my understanding, was added because in 2010 there was a couple of community colleges that through press and news outlets we felt like we're in serious financial condition, and the LBB at that time conducted a study as to what oversight was being done at the state level for community colleges to alert state leaders about financial condition of the community college districts, which operate locally with the local elected board. And so that is the reason for the for this report being generated for your approval.
Any questions of Gary?
Does this require an approval or acceptance?
Yes, it does.
And who does this report go to, Gary?
This report goes to the legislative leadership and to the governor's office. The LBB has requested that they get a copy, plus we will send copies to the chairs and the committee members of higher education committees in the legislature.
So you don't send it to the community colleges?
We do send a copy,
Okay.
yes,
That's
I'm
fine.
sorry. We do send a copy to the community college. We've already sent a draft of this copy of this report to the community colleges earlier last month for them to comment.
And did you get comments?
Yes, there are two comments in the report, one from Coastal Bend and one from Victoria College.
Is it required that they show this report to their board?
It's
college,
not, it's
the individual
not required.
colleges?
It's not required.
So that wasn't part of the legislation or requirements?
It was
or?
not. And when we have the leadership training, the financial training for the new trustees at the community colleges in November, like we do mention this and tell them where it is available for them to review.
So that is a very good question. Dr. Gardner, is there any reason that we would not send this to the community college members of their boards? All. I mean, this is the kind of accountability and transparency that everyone should see.
I think we certainly could do that.
We can do that.
Okay, so I move that we approve with the caveat that it be shared, a copy of this be shared with the board members of all of the affected institutions, every institution that is underneath this review.
We have a motion and a second. Any additional questions? All in favor of the motion say aye.
Aye.
Opposed? Thank you very much. Agenda item 5D is a report on facilities projects that were submitted to the coordinating board. You notice that there have been very few submitted this quarter. Susan Brown is available for any questions on the handful that are submitted.
Yes, and there's really not a lot to say. There were only 3. They met the criteria.
Okay.
So we
we may do nothing, but you've now reported back.
We have reported that.
Thank you for that. Agenda item 5E, 1, 2, 3, 4, and 5 are on the consent calendar. Agenda item 5F is also on the consent calendar, which brings us to agenda item 5G, which is an update on the Texas Higher Education Strategic Planning Committee activities. Dr. David Gardner, Deputy Commissioner, Academic Planning Policy, Chief Academic Officer, and Susan Brown, Assistant Commissioner, Planning and Accountability, will provide an update, which we're anxiously waiting to hear.
I'm sure you are. This will be very brief. The committee has had its initial meeting, and I'd say the committee members were very engaged. They heard a report from the state demographer on the current demographics of the state. I'm sorry, he's not the state demographer any longer. Steve Murdoch from Rice University, who's former head of the Census Bureau, former state demographer. There was a lot of discussion about the starting point, which you've heard before, the wave from the Council on Continuous Improvement and Innovation, particularly on the workforce aspect. I can say that it's clear that there will be more emphasis in this plan unless they change direction later. much more on the workforce, much along the lines that you've heard today. We anticipate they will hear the RAND report later in the process. We will be engaging key outside experts as issues arise. We've already had an agreement from OECD and Andreas Schlichter, who's the director now, to participate with us via Skype in terms of international issues. We're having conversations with Tony Carnevale about when he might appear. So we're well on our way. When we get the dates for all the committee meetings, we'll let you know when those are, so you can observe, if you like, by the web. They will be webcast. Woody Hunt is chairing that committee. I should add, at the committee, they confirmed his role as chair by voting themselves, and they elected a vice chair in Larry Faulkner, the former president UT Austin. It's a very, very strong committee, and we'll keep you up to date as we go along.
Those webcasts are available on our website if somebody wants to go back and look through them.
One last thing I should add is that they are going to use the technology we have. It's called Town Meeting, and is it College Town Hall? I'm sorry, and they'll learn more about that at the next meeting, how to use that, and it will be a way for people out in the state to share ideas and thoughts with the committee through that process, and the members of the committee will have access to that site. So it's one technological way to communicate that we didn't have available more than a decade ago when we started.
So they'll have access to that while they're meeting?
Well, it will be online all the time. They'll be able to webcast, but it will be a place for individuals in the field to post comments, ask questions.
And so would those be addressed during the committee meeting?
They might be addressed during a subsequent committee meeting, depending on what they have, and if there's some trend in terms of what everyone's wanting to talk about. And of course, we all know that sometimes there'll be a lone individual who bring up an issue that no one thought about, which is very critical. Right. And so that's one of the strong aspects of using this technology. We've not really used it actively like this before. They will receive some instruction on it at their next committee meeting.
It'll be interesting to see. Good. All right, any other questions of David? All right, agenda item 5H is we will now break for lunch, the committee will, and while a quorum will likely be present, no public business or public policy over which this board has supervision or control will be discussed. We intend to reconvene at approximately 12:55, so we are breaking for lunch. Next agenda item is item 5I, which is adjournment. So I would entertain a motion to adjourn.
Move adjourn.
And second, all in favor say aye. Aye. Opposed? We are adjourned. Thank you.
Okay. See you, Chris. You have to take off too, David?
Chairwoman said we're going to go.
That's good.